Hi, welcome to the Board of County Commissioners work session meeting on Tuesday, February 22nd. In the room with me here, I'm Francie Jacober, the Vice Chair. In the room with me, John Peacock. The other commissioners are online, Greg and Kelly, and I think Steve is going to show up in just a minute.
There's Steve.
In fact, there he is. So we're going to start with a special meeting, and I'm going to turn it over to John.
Yeah, and Francie, can I get you just to call the special meeting to order, just for the record?
Okay, I'm calling the special meeting to order. Do we
Thank
need to
you.
vote
That's,
on anything?
nope, that's got it. I just
Okay.
need you to call it to order. Thank you so much. We have a very brief special meeting scheduled today, and it's for the board to consider and I will read the title so you all don't have to. It's for the board to adopt a resolution of the Board of County Commissioners of Pickens County, Colorado, repealing Resolution 14-2020, adopted on March 17th, 2020, ratifying the Pickens County Manager's action on a declaration implementing a local emergency disaster and rescinding the local emergency disaster declaration ratified in response to the COVID-19 pandemic. Originally, I had, under our home rule charter, issued an emergency declaration on March 12th, 2020. That was the same day that the public health director issued a public health order to implement measures to protect Pickens County residents and visitors from the emerging COVID-19 pandemic. Pickens County was the first county to detect COVID-19 on March 8th, 2020 in Colorado. And that first public health order was done in cooperation with Eagle and Garfield counties, and was the first public health order that was issued in the state of Colorado. We signed the emergency declaration in order to, one, be able to initiate our own emergency response capabilities, particularly with our incident management team and emergency operations center and all of the resources that come with that. And we really were in a response mode for quite a while. Coming up on 2 years now. So more recently, as this board is aware, the Board of Health voted to sunset the Pickens County public health order related to COVID response. That public health order sunset at midnight, started at midnight on the 22nd, today. We're coordinating the rescission of our emergency declaration with the sunsetting of that public health order, just like we made the declaration in concert with adoption of the public health order. So with that, Francie, I'd open it to any questions from the board.
Okay, does anybody want to comment? I have to go to.
You can also look here.
Oh, yes, Greg.
Oh, hi, just wanted to say it's great to see you all not wearing masks. That's the first thing I noticed. It's like, wow, we're not wearing masks. I'm optimistic about this, and it's just shocking to me that we've gone through 2 full years of this, and this has been hard, and I know how hard it has been for every one of us and the community as well. So this is a momentous occasion. Thank you, John, for laying out the history there. And it's easy to forget. It's been 2 full years, or is it more than that? So anyway, thank you for that. And I don't know when you'll be ready for a motion. If we need one, but I'll make the motion to rescind this order when the time comes.
Do we need a motion?
We will need a motion. You have
Okay.
hands up from Kelly and Steve also.
Yeah, I see that. Steve? You
Kelly
are-
first.
Okay, Kelly, go ahead, and especially since Steve is muted.
No worries. I know we'll all get our chance. Gosh, I just want to reflect a little. I mean, 2 years, so much has happened. I know I've gone through a lot of personal growth as just an individual, a mom, and a leader in the community during this really hard time. I think for me, I take away a lot more compassion, and I think a little bigger, I guess, interest in grace and capacity for extending grace, not knowing everybody's individual situations, and also understanding that this pandemic has affected each of us deeply and personally. And, I look back at it, really for me took a long time, longer than hopefully in the next emergency, to figure out how to think about this as a decision maker. And I know for me, I came down to kind of looking at this pandemic in terms of when we had to make all these decisions in a really chaotic context and with so many unknowns and just ever-changing information and access to resources and trouble to getting resources and fear from the community. Eventually I came down for me to look at this and the way I made decisions through the lens of, are we following the science? And when the science wasn't clear, are we protecting the most vulnerable in those instances where the path was not obvious? And then finally, as a government, are we mitigating for the impacts of our decisions and the hardship that they created for people and businesses, et cetera? And I continue to think of this pandemic in those three ways. And especially, I think the last one is we continue to be there. There continues to be hardship. Our local community, our local economies have changed drastically from this pandemic that we're going to continue to have to react to. And I think making decisions of, what was the impact here? And are we protecting the most vulnerable? And so I carry that forward even as we rescind the emergency ordinance of when I think about our work ahead. I'm proud of our board, even despite the differences. We really learned together as a group of 5 how to move forward despite our differing opinions. And just want to applaud Greg and Patty and our Board of Health, who I really think were steadfast and did their very, very best to lead us through this tough time. And so here we are. It's not going to be easy for everybody moving forward, and I keep that in mind, but I am also looking for a real getting back to normal too. I'm looking forward to that. So hopefully we'll all get to celebrate in person, maskless, in a social way, maybe for the first time in many years. Thank you.
Steve.
I agree that this is the right time to rescind our declaration of emergency. It doesn't mean that the pandemic is over. There are still people getting sick. There still will probably be spikes in different variants of the virus, but I think the fact that so many of our residents here got vaccinated and so many have also gotten mild cases of the illness, that we as a whole are fairly well protected, and the hospital is not in any danger of being overrun by a surge of admissions right at this time, and can, I think, start to get back to a little bit more normal for them on doing their elective surgeries and different things that a lot of them, I think, have been put on hold to some extent. So I look forward to not being in a state of emergency. If the need arises, we know the drill now. We could put declare another state of emergency if it's just a really bad variant comes around and a whole bunch of people start getting sick and going to the hospital. We maybe would want to reconsider at some time in the future, but for now, I think we're in a good spot, and I agree with passing this resolution. I guess it's a resolution. So thank you. I'll pass it on to Greg, I think, here.
So is that a second, Steve? Are you seconding? the motion?
No, there wasn't a motion made yet
I thought Greg
officially.
made a motion.
Well, I kind of did, but I'll make the motion. But I did want to ask John a question. You know, now that we feel as if we're getting our heads above water here, which may or may not be accurate. I'm wondering, do you have any ideas about, you know, what can we do to revisit this and examine what we've just gone through in the last few years and help that, you know, shape policy and practice for everything from the IMT down to the commissioners and the Board of Health. There's so much to look at and so much to understand about what we've all just been through. As Kelly says, you know, a lot of the time we were feeling our way, and we still are to some extent. And I keep thinking, I hope somebody is going to study this. This will be, as you've said, years and years of study will go into what just happened. And I think that will really serve us well. So I'm hoping that we put some resources toward that in some way.
Yeah, thanks, Greg. And I think that's going to come on several levels. I think one, I want to echo what I think I heard from Steve is the pandemic is not over yet. We have weathered some really, really challenging times as a community. Our hospital capacity is you know, back to comfortable. Our numbers are dropping, our hospitalizations have dropped off, and so we're relaxing our posture of an emergency response in the public health order. But the pandemic is still here, and so people still need to be responsible. We are in another phase, and I think, Kelly, this is what I think I heard a lot of in your comments, that we still have significant impacts in the community and changes in our local economy that really move us from the next to the next phase of response. And this has been an incredibly long response. I want to ask Jeanette, I think this may be our longest standing emergency declaration in Pickens County's history, but I can't confirm that yet. But this is really just designating a stand down on our response, but we still have a lot of recovery work to do. And so this board's going to be hearing about some of that today, around housing, around you know, our efforts around access to health care and such. And so we are still doing a lot of work. But more specifically, to answer your question, Greg, yeah, we need to do what's called a hot wash on this, on that response phase. And we'd probably look to roll that more towards the spring or summer. Make sure we don't have another surge that we're responding to give, you know, see what lessons were learned in terms of our initial response, our initial challenges, and that sort of thing. And also keep an eye on recovery. I think we're going to know a lot more in 2 or 3 years about what actually worked in responding to this pandemic than we know right now. And so this is going to be an iterative learning process that we as leaders need to keep in mind and learn from and pass on, because hopefully we'll never have to deal with something like this again, but others may. And so to that end, Greg, I would look for hot washes to happen late spring, early summer, and then for that learning to continue for a long time.
Right, thank you. And I think much can be applied to other, you know, I think of the long emergency as the climate emergency. This was actually a fairly short-term emergency.
Fair enough.
But there's a lot we could take from it. If you're ready, Chairwoman Francie, I'm glad to call you that for the first time. I would make a motion rescinding the emergency resolution number 14, 2020, implementing a long local emergency disaster.
Do I have a second?
I'll second that. Can I make just another brief comment?
Okay.
Yeah. It's so interesting to look back on some of the human behavior that we've learned, I think, over just, you know, remember when a 300 incidence rate was like the catastrophic level early on, and when it was such a political battle to have the affidavit introduced when now, regular proof of vaccination is sort of ordinary and accepted. So I think about these things as well, just sort of our iterative nature as humans as we progress through these emergencies. And then also, really just honor vaccines. To me, continue to be like one of the greatest success stories of modern medicine, throughout the last several hundred years. And this vaccine rolled out faster than any other had in history. And, wow, what an incredible, I think, pulling together of resources. And, kudos to our community for taking advantage of that. And looking ahead to, we're going to have to get back on track with some of those childhood vaccine schedules, I think, that have fallen behind, despite our community's support. So thank you. And, again, look forward to the new chapter.
Thanks, Kelly. I had a couple of things I wanted to say. I was chatting with my son Rio this morning on our carpool ride in, and we were remembering when the whole world stopped and all the towns and cities were empty. Particularly, we all felt a lot of compassion for the people in Italy when we saw them in their balconies, and the way they would cheer the health workers on their way home from work, and the photography of wild animals roaming the streets of downtowns. It was pretty amazing. And I also wanted to just take a minute to give a shout out to all our essential workers. For me, I particularly feel the work of the restaurant workers because I run a restaurant in Carbondale. And my employees never missed a day of work. We were essential from day one. We were the only restaurant in Carbondale open. So when I would drive down there to meet with my employees, there would be no cars parked on Main Street in Carbondale, not a one, until you got to Fat Belly. And they were incredible, as all the people were up here in Aspen as well. They worked through the entire pandemic, and 5 of their parents and grandparents died during this time in Mexico, and they could not travel for the funerals or to say goodbye. It was incredibly moving. I also want to remind us that during that terrible time when the world was shut down, we had a significant reduction, I think it was 17%, if I'm not mistaken, in CO2 emissions around the world. And that is just something to look at and think about. I heard a story on the radio, or maybe I read it in the paper, that Omicron has been incredibly pervasive, and the one good thing about Omicron is that it beat out Delta. So when Omicron started taking over with its milder symptoms, almost all of the Delta cases with their stronger symptoms disappeared, and Omicron won. So I just want to recognize the changes that we've been through in the last 2 years and how difficult it's been, and how this is a celebratory moment. We should be celebrating, and I know that's hard. If you have COVID right now, or somebody you know does, it's hard to celebrate, but I do think we have nationally passed some kind of barrier, and I hope it lasts. So with that, I will call the vote. So all those in favor of approving the resolution, rescinding the emergency resolution, please say aye.
Aye.
Aye. So it passes by a vote of 4-0. Thank you.
4.
I think with that, we can adjourn the special meeting and move into our staff and community presentations. John,
Okay.
do you have anything with that?
Yeah, so I'm happy to introduce Chris McDowell. Chris is the Executive Director of the Valley Health Alliance. We are one of the founding members of the Valley Health Alliance, and I think over the past couple of years, Chris, given all our distractions with other things, we haven't had a chance to get an update. And so today, you'll be hearing from Chris, update of the Valley Health Alliance. Later on, you'll be hearing from Ross Brooks about our partnership on Mountain Family Health Centers and the work we're doing there for access to health care and housing. So a lot of the recovery work actually that is going to be following up on the pandemic is rolled up into here. So Chris, if I could turn it over to you to talk a little bit about what's happening at the Valley Health Alliance. You'll have to unmute yourself there.
Thanks, John. Looking forward to this conversation, and thank you so much for the introduction. And yes, we've been busy, even in spite of the pandemic. A lot has gone on, and I would have to say Pitkin County has been one of our benchmark members in many levels, in many ways, and a lot of that has to do with John, but and includes his organization as well as the support of the county commissioners. So we really appreciate your help and your support in this. I think we're really starting to see the pendulum swing in our favor. We know that it's always a journey when it comes to healthcare, no destination. So we continue to improve our situation, and what I share with you today hopefully will give you an update of what we've accomplished and where we are. And please interrupt me anytime with questions. I don't mind. One-way conversations don't usually provide the best information, but I'll do my best to give you a good overview so that you can ask the questions that you need to. First of all, I'm going to show you a little video that we put together about what we've accomplished. The Valley Health Alliance does provide a unique vehicle for collaboration, and I think the hallmark of the Valley Health Alliance, and you'll hear it from me several times in this brief presentation, that it's a partnership between employers and providers, and that partnership is what's brought us the greatest success and offers the greatest opportunity going forward. And the real focus of that partnership is creating the best optimal relationship between a primary care provider and their team with our employees, i.e. patients. So with that being said, this is a brief, it's only about a 1.5-minute video, so, but I think it gives you a good overview of what we've been doing.
Originally formed in 2014, the Valley Health Alliance is a not-for-profit organization working to create a sustainable healthcare system in Pitkin, Western Eagle, and Garfield counties. Our goal is to improve access to quality care while lowering costs, helping our members get the right care at the right time and the right place for the right price. Collaborating with healthcare providers, hospitals, and some of the region's largest employers, the Valley Health Alliance has created a primary care network to connect people with family providers who can help them navigate the healthcare system and achieve the best outcomes possible. Providing well-coordinated, accessible, high-quality, affordable care in the communities where employees live improves personal health and well-being and achieves safer, more effective, and more efficient results. This coordination of care starts with our primary care network. The Valley Health Alliance is also working to expand health insurance choices. Whether you're an employer in the Aspen to Parachute region looking to provide quality and affordable benefits to your employees, or an individual trying to find a plan for yourself and your family, we have a variety of options for you to choose from. We have a strong community, and the Valley Health Alliance is proud to be a part of it. Learn more about the Valley Health Alliance and the benefits it can provide by visiting our website.
So that's a shout out to Parker Smith and Feek, who's our broker for the VHA, but also the healthcare insurance broker for Pitkin County. They've been a real asset and a real benefit to our organizations, and I think they're going to continue to be a catalyst for a lot of the good things that we're doing. Back to remembering why we started the VHA, some of the most expensive healthcare in the country, as we all know, and the VHA wanted to bend the cost curve, and I think that's one of John's greatest influence on our organization, is understanding that we may not be able to reduce it, but we'll certainly bend the cost curve. I'll have a little bit more on that later. And how do we do that? Again, going back to that collaborative leadership through the VHA and the work that we do together. Leadership includes employers and providers in partnership, and that partnership built on trust is so critical. But the vehicle or the focus or the operations of that is primary care. Again, going back to the Quadruple Lane, some of you may be familiar with about better care, better health, lower cost, and engaged primary care or providers in general, whether it's hospitals or specialists. The key here, though, is trying to understand the value that equals quality and cost over cost. And if we found that by improving quality, we do reduce the cost, and now we've been able to prove that theory through the VHA's efforts. And kind of in our evolution as we grow, we're looking at what that value really means. And I call this the transformation of the Quadruple Lane. And as you saw before, right care, right time, right place, right price. That is the evolution. I think we have to start with one and work our way all the way to right price. And right price is kind of the homeostasis that we look for between the employers and providers in our community. And you can only get there through the effort of transformation through first finding the right place, making sure everybody's going to primary care and at the right time so that it's timely and before the complications become a problem. And then making sure they go to the primary care at the right place and not utilizing the ER for their primary care, which is very typical within our community. But we've certainly impacted all those. And then the right price, and I'll talk a little bit more about each one of these, but the right price really is the understanding of making it affordable so that price doesn't become the barrier to care. Looking more of really what works and what we found to be really helping is this, patient-centered approach and having that care coordinator, which at least 3 or 4 or 5 of our primary care providers in our community have successfully adapted and transformed into this kind of model. And it's really starting to show a real difference, and we'll talk a little bit more how that impacted individual insurance within our community as well. But you can see that patient-centered with that relationship between the primary care provider and his team, primarily the care coordination, which usually includes a behavioral health person, mental health, in addition to the physical health. That integration has been really impactful. But what does right care really mean? It says create a conversation between the provider and the team and the patient. It's shared decision making, and that's probably the key concept to take away from this. It makes it high quality and affordable and effective. Right time, again, it promotes prevention and wellness before the problems occur. And right place, correct utilization of services starts with accessing care in the right location, primary care. Knowing when and where to access health care can dramatically affect the total cost of care. I think it's tenfold if you use ER versus primary care for your primary care services. So it's much better to utilize the physician's office rather than going to the hospital ER. And then right price. There's two really prongs to this, many more I'm sure, but for this conversation, informed consumer is foundational. That's really the best way to, where we go to get our care, how we affect volume by how we guide our employees through the benefit design is key. As a provider, I think, and you'll hear this from me hopefully more than once today, for so long, we've always advised our friends and neighbors to take an advocate with you when you go to the hospital or to the physician's office to make sure you get your needs met and taken care of and you don't forget something. I still think that's a good idea, but I think the impetus now, as we look at right care, right time, right place, right price, the catalyst for that is for our hospitals and our physicians in our community to become advocates again, to advocate the highest quality care at the lowest possible price. And that's really, and that's price transparency. As we work towards that, there's several things that we're still doing within the VHA that are helping us get closer to the price transparency. And John is part of that effort too, and I really appreciate his influence on that. So that's the how. Now, what's the real value? And we talk about quality continually, and quality is measures. And if we look at performance improvement, quality improvement, they're all based upon process and outcome. And within the VHA, we have a scorecard for our physician and their practices. These are the quality measures, and this measures the process and outcome of how those practices manage the patient. and we give them targets. So they measure, they look at data, they evaluate whether they're doing a good job based upon process. So I always use the example of diabetes. Good process means the patient goes in to see the doctor 4 times a year to get their A1C checked, which tells you the last 90 days of your blood sugar levels. And that's good process. Good outcomes means that the practice is able to manage the diabetes to less than 9, which is acceptable levels. So means controlled. So that means a good outcome. And that's why process and outcome. You can do it with weight, you can do it with cholesterol, you can go down the list of the different things that we encounter. As you can see, there's a few of these on the list. But this is what the physicians within our community, I think we have 98% of all the physicians, primary care docs from Aspen to Parachute participating. So it's really helping, and you're starting to see that transformation within the community and the healthcare, higher quality, lower cost. Cost control, this is going directly to that. Per member per year, how much does it cost to manage or pay for your employee each year? Now this is VHA aggregated. I think Pitkin County is our benchmark. They've been the most dramatically impacted by this. The national numbers, this is by Kaiser. If we look at the national number, PMPY, for employers, it's about 7,739. And the work of the VHA has created a 6,943 per member per year. I think Pitkin County is a little bit lower than that, closer to the 6,000, maybe even the 5,900 number. Here's what we show at the VHA. Originally was 8,000 in 2018. 2019 we saw a bump. 2020 it started to decrease. I do think the pandemic had a part in that, but 2021 shows that we're making an impact. Now this is aggregated numbers. I think Pitkin County showed the greatest improvement, and I think we see that in that John was able to offer all the employees a lower premium this year, which is huge. I think that's the first time in my 20 years that we've been able to do that I've been in this community. So kudos to John and his team for what they do. And why? I still think it really comes down to trust and that relationships that we have. Open dialogue, transparency in pricing and billing, those are statements that are still goals in some ways, but I think we're getting closer to that. Partnering with providers, engaging the physicians, our clinical advisory board, which is a piece of the total board, they are the captains of the ship, and they found throughout the country the best impact is when your physicians are leading the way, and sure enough, that's what we've experienced here. We're making affordable and sustainable healthcare for the entire community. It's data-driven, so it's very objective. It's like a blameless autopsy. We're not trying to point fingers at people for how they set their pricing or how patients may go elsewhere. Best practices clinically and financially, providing context for optimal conversations. So we create a safe environment for the board to have those conversations that are really important for creating sustainability. In our progress, this is probably what I'm most proud of in our group. What we've accomplished so far, again, we have a clinically integrated network. In a rural healthcare community, most people are kind of doing their own thing. And in the first 15 years that I lived here, that was pretty much, everybody did their own thing. Whether it was clinically sound or not, it was more for financial sustainability and survivability for many. But we got them all engaged in part of that network, so that's really helped improve how we manage care with all of our employees. Another big feather in our cap is the 3 hospitals working collaboratively. Rifle, Glenwood, and Aspen. They're really trying to find ways to save money. Whether it's, like a neurosurgeon or a pulmonologist, they'll share it rather than compete over getting the best, neurosurgeon or those things. So it becomes much more collaborative and better for our community. It is an ecosystem of employers and providers, and there is a shared savings program. Hopefully here we'll find out more about our first year, which was 2021, in a shared savings, and we'll be able to talk about that more in quarter number 2 this year. Again, seeing it up to 10% PMPY in aggregate for the VHA, and some of our individual employers as much as 20% PMPY. And I'm talking about Pitkin. There's some real savings that has experienced thus far. everyone pulling on the same rope in the same direction. I think everybody was pulling on the same rope for many years, but now they're pulling in the same direction, which is really good for our community. Now John asked me to highlight this, and this is really good. We partnered with Rocky Mountain Health Plans to help lower the cost for the entire community, not just the VHA employees, and they were more than willing to participate. And they were able to offer lower rates based upon the work that was being done within the clinically integrated network. So 4 or 5 or 6 of those practices were doing good care, and it was showing on an actuarial level a savings for the community and for Rocky. In 2021, when they started, January of last year, they came in 10 to 15% less than Anthem, who was the only game in town for many years. So they came in very competitively. In 2022, it's 10 to 20% in some cases, depending on your gold, silver, or bronze. But the big key here, and this is probably the big takeaway, is for the first time, Rocky's plan went down 6%. From 21 to 22, and that's huge. Now, 6% in the big picture, if we look at, in reality, what it costs individuals for healthcare, it's kind of a drop in the bucket, but the most important thing is it's moving in the other direction. Instead of increasing annually, it's decreasing, and hopefully we can maintain that with our work here. Right now, there's 3,500 lives within Garfield, Pitkin, and Western Eagle, our valley, essentially, down to Parachute. So about 3,500 of those lives, which is, they figure, a little over 30% of the total marketplace for individual health plans. And then for entire Western Colorado, 14 counties, there's over 6,000 lives that have signed up for 2022. So there's a big increase. They had almost double sign up. So we're seeing that we're helping the community by partnering with Rocky, and their work with us is showing dividends, and hopefully will continue and be sustainable. And that's our goal, what we hope. With that being said, before I jump into the future, do you guys have any questions?
Greg?
Sure. Yeah, I thank you. Yeah, just looking at that, so 3,500, 30% you said of individuals' lives signed up for this. That's just great. What's keeping the other 70% from signing up? And are there economies of scale, or does this just get more expensive? I'd love to know. You always think that there'll be economies of scale, but I just wonder if that's actually true in this regard. Can we afford to put more people in this? Naive questions, but thank you.
No, and I think that's a great question. Goes back to our work with the Aspen Community Foundation. We're actually reaching out to the eligible but not enrolled within our community. There's about 43% of our community are eligible for through the ARP, the American Recovery Plan. There's funding through the Connect for Health Colorado that can significantly reduce the cost of premiums. And so 43% of our community are eligible but not enrolled. That means, I think it was about 1,900 lives that could benefit from that. And so what we also figured with the Aspen Community Foundation is the Spanish-speaking community. There's a lot of people out there that are eligible. So working with the Roaring Fork leadership, Aspen Community Foundation, and also with the State Division of Insurance, we are in a current developing a program for this summer to engage more people to enroll and to address where those might be. So in concert with Connect for Health Colorado, which is really a subsidiary of the Division of Insurance, but for people to sign up for individual plans, that's kind of the focus. And so thanks to the Aspen Community Foundation, we have some funding to go after that and to work with Roaring Fork leadership. And they have a civic project that they would like to work with us on that specifically. So Spanish speaking, but also helping those that haven't taken advantage of this opportunity, because it's not just a little, it's quite a bit. In fact, it's probably, reducing eligibility or the cost, the premium down to 8% of your income, 7 to 8%, which is huge. For many people, it could be the difference of, paying $500, $600 a month down to $50. It can make a huge impact. So those are the couple of things they're working on with Mountain Family, and I know Ross and I have had many conversations about this, and he'll be sharing that with you as well. It's been so nice to have Ross on our board. He's been a real asset as well. And he is totally supportive and in concert with what we're doing to address the uninsured. And that's really neat. I think we're going to see some real momentum this year in addressing those issues.
Kelly?
Thank you. I just want to sort of clarify if I'm understanding all of this correctly. I'm pretty sure I understand VHA's role here. But when somebody who is looking to research the products, so we have the employer-based product that Pickens County offers to our employees. Then we have a product that small businesses could access and individuals could access. And when the small businesses and the individuals go to access it, they're doing that through Connect for Health Colorado. And then the option is the Rocky Mountain Health Plan. Am I understanding that correctly?
Yeah, I'll give you a thumb sketch on this. It is to Connect for Health Colorado is where we encourage everyone to go. Taylor McBride, who's my administrative assistant, has also become an advisor to help people sort through, whether they're a small business or an individual, where they can get the best rates. What Connect for Health does is it presents all the options, and it doesn't promote one over the other. And because Taylor is one of those advisors, he's not allowed to say, take Rocky, but he's allowed to point them to look at them and say, look at these rates, look at where your out of pocket is, because that's even more important than the premium. And so we point people in that direction. And there's a couple of options out there for people, the small businesses, to look at ICRAs, which is an individual compensation health reimbursement account. Those are ways for small businesses to even better meet the needs of their employees, where they may just give them a stipend and they go out and purchase on the Connect for Health, because it can be significantly cheaper for everyone, including the employer, in those situations. The small employers, your 5 to 10. So those are the several things that Taylor can assist people with, and we give them. If you go to our website, I think you'll find something you can be very proud of as being a member of the VHA, rvha.org. It offers some really good information around this and helps guide people toward that. And that's what we try to do is we're here as a facilitator for lower costs for our community. Does that answer your question?
It does, yeah. And I know, yes, thank you. That helps to make sense. It helps me for understanding, it's not so much necessarily to talk about the VHA when people are asking me about where they should necessarily seek out health insurance. That's more of kind of the background of what the foundation of why it's the best time now. If you've never purchased insurance, you might be more encouraged now than you ever have in the past to do so. So that's helpful. Thank you.
Yeah, and I can't overlook the brokers in our community. We do refer people to the brokers, and there's some that have had long relationships with some of those small businesses. But we always point people to brokers as well, and then the brokers sometimes point them to Connect for Health. But Connect for Health is a great place to start because you can actually look at your numbers and how it works for you. It's very complicated still, and that's why Taylor, we've got him working on it to help simplify the process for everyone. And we're getting there. So.
Thank you, Kelly.
I guess I have a second question. I'm wondering, and I don't know if this is more of an offline thing, Chris, but I am curious about the reinsurance effort that the state took on a couple of years ago, and that was a time-limited effort. And so if that has been really important in helping drive down the rates and is something we need to continue to pressure the state to retain, that would be helpful for us to know as well. Thank you.
Yeah, that's a great point. And I think in conjunction with the public option, that's going to have an impact. And Rocky and the VHA have been working closely together to make sure that what these offerings are totally compliant with the public option. So we fully intend to be the public option in our efforts. That's our plan. But yeah, the reinsurance has had a significant impact in most of these situations. So I think it doesn't hurt to have that out there still.
Is that all, Kelly? Thank you. Steve?
Thank you.
Chris, do you have any sense of how much the decrease in the healthcare costs have been due to people not getting treatment for things that they really should have gotten treatment? And I would look at that as there's a whole lot of deferred maintenance out there in people's bodies that wasn't taken care of. But at the same time, during the pandemic, there were a lot of lifestyle changes, some good, some bad. I think being mostly stay at home, I personally found I was eating too much and not exercising enough. So those were lifestyle changes that I'm taking action now to reverse course on that. But how much does the Valley Health Alliance work on people doing the right lifestyle choices to get enough sleep, get enough, eat properly, get the right amount of exercise, keep their mental health in the right place, all those sorts of things?
Great question. In 2020, I think we saw a decrease in utilization, obviously. But I think 2021 has more than, I think you saw a lot of that come back around, particularly the end of 2021. So I think we're back on par, or the new normal, as they would say. In terms of wellness and prevention, that was kind of the hallmark of the VHA at the beginning in particular, and particularly health coaching. I actually was one of those that got certified to be a health coach. And in 2014, 15, 16 in particular, we saw that the 40 people that we trained weren't really being utilized, and the 5 big employers at the time used internal health coaches to manage that. So I think what we came to realize is for health coaching to work, it has to be built on the foundation of primary care. So I call a health coach the cherry on top. And, you know, in our efforts, we risk stratify all of our population, all the employees. So, you know, the ones are your healthy that see the doc once a year or every other year. That's 65% of the employees. And about 15 to 20% are level 2, maybe level 3. Level 2 is like your skier who injures themselves or a pregnancy. Or level 3, which is, you know, starting to see diabetes or obesity starting to become a problem, those types of things, going back to that wellness. And 4 and 5 is the real complex. But I think for success of the VHA, we've got to get they call it rising risk. So your 2s and 3s before they become 4s and 5s. And part of that is looking at that whole person. And what I'm going to talk about next here is going to be specific to that. But mental health and wellness is really the catalyst that helps all of this. And each of the practices have a care coordinator, care manager, and mental health person to help address these specific issues, Steve. I think we're right on what you said. But in our evolution, you know, I showed the how before, and we talked about those measures, those quality measures. I'll go back over here. Those quality measures, where did I go? Sorry. Those quality measures that we follow and do. There we go. So this is and what we found, even though this is the work that has been going on in healthcare, particularly since the Affordable Care Act came, because this is the piece of the Affordable Care Act that people don't hear about. And if you talk to Ezekiel Manuel, who came to the Aspen Institute, and he talked about what the purpose of the ACA was, and it was a 20-year view. It wasn't just a simple, and that 20-year view is to change how care is provided. And so that evolution started with the help of IHI and Don Berwick. If you guys are familiar with him, I encourage you to read about him. And the Institute for Healthcare Improvement really has been the catalyst throughout the whole healthcare system to go through process improvement. And so what we found, though, is data sometimes becomes paralyzing because we look at so much specific data, and sometimes we're just trying to check the box to be meaningful. And I think what they have found now if we look back at the entire picture, let me go forward here. If we go to the entire picture, we're starting to see that really, for a real improvement, we've got to engage the patient at the very fundamental level. And Gary Canals, who's our Chief Medical Officer for the VHA board, has been a real catalyst for this look. It's a simplification of all of this, and it puts it in the hands of the individual as they come to the practice. And he did this with us at our board meeting last Friday. John, I know you weren't able to be there, but this was what he shared with the board. And I want you to I'm going to be quiet for about 30 seconds. Look at these questions and how important they are.
I'm just going to read these out loud in case someone's watching on Grassroots. They won't be able to see them. So, the practice makes it easy for me to get care. This practice is able to provide most of my care. In caring for me, my doctor considers all the factors that affect my health. My practice coordinates the care I get from multiple places. My doctor or practice know me as a person. My doctor and I have been through a lot together. My doctor or practice stands up for me. The care I get takes into account knowledge of my family. The care I get in this practice is informed by knowledge of my community. Over time, this practice helps me to meet my goals. Over time, my practice helps me to stay healthy.
Thanks, Kelly.
And before you go on, Chris, I'd love to ask a question.
Please.
So you mentioned there are 1,900 people in the Valley who are still eligible for, is it the Rocky Mountain plan or?
The benefits, the tax break that provides the subsidy for paying for the premium.
Okay, and how are you eligible? What makes you eligible?
Income.
Totally income?
Yeah, it's usually 400% of poverty level.
Uh-huh. And then what if you are undocumented? Are you eligible?
No, but we are wanting to help our undocumented connect with particularly Mountain Family Health Centers. That's their wheelhouse. We really encourage folks from the undocumented community to reach out to Mountain Family because they will help them. And the public charge issue has been mitigated. I don't know for how long. It always depends on what's going on in Washington. But that issue has been addressed, and Mountain Family is really the right connection for our community there.
Oh, great. I'll look forward to hearing from Ross then. Thank you.
Yeah, sure thing.
Any other questions right now for Chris? Well, why don't you go ahead then, Chris?
So why are these patient-reported outcomes so important? How does this help? Well, if we look at the primary care, they really need to meet the patient's need by focusing attention on what really matters to the patient. And those 11 measures have been set up in questions with, does it sometimes, always, those type of questions to help qualify and quantify whether the practice is successful at that. But the person that developed those 11 and the organization that developed those 11 measures took all those measures I showed you on that other quality measure list, and there's usually anywhere from 90 to 120 of those measures, and most practices have to answer to at least 15 to 20 depending on which Medicare program or special program that might be going on. So after doing all this work looking at those measures, they really came up with those 11, and if you can do a side-by-side comparison, comparing the old measures with the new measures, and it's not changing or abandoning what the old measures have done, because you still want to provide good care and quality, but it helps change the focus. And for primary care, it reduces burnout, it makes it simpler because they don't get caught up checking boxes, they're really listening to the patient, and that's why it's important for primary care. For employers, it gives us the ability to assess if the care that we're paying for is actually making a difference. And what matters for that patient. And it requires that the system support aspects of primary care that matter. So it helps us incentivize primary care to do the right thing, to provide the best care possible. And I think it simplifies it for all of us. When we talk about patients, it gives them the chance to really participate in how the system is improving for them. And it provides important information for caring for them as a whole person, going back to what Steve was talking about within the practice. And it puts us all in the supportive position that we want to be to making the best outcome possible for our employees. And for the insurers, it identifies where to invest to support high quality care. So it helps us support those practices in whatever areas they may need, whether it's accessibility, which is always the biggest challenge in rural healthcare, whether it's adding mental health, integrating, or a better electronic medical record. So it always helps us develop systems that support integrating, personalizing, and prioritizing care. So it kind of gives you the best outcome that way. And that's kind of our next level of evolution in this, in addition to what we talked about in helping the entire community become engaged in their healthcare, whether it's the eligible but not enrolled folk, whether it's the uninsured, whether it's the undocumented. All of our efforts are trying to help get everybody to see their primary care doctor, because that's the best way to save money in our system. And the last but not least piece, and I'll just plant this isn't on the Prezi here, but it's on our board level. We've created a financial review committee, and John is part of that integrally. What makes that unique is that it's all the employers in our group that are not providers, because currently we have 6, with 1 or 2 more maybe joining us this year, employer groups. But the 6 are SCICO, Pitkin County, City of Aspen, and then the 3 hospitals. But they're there as employers, not as providers. They just happen to be providers, but they're here trying to solve the same issue for their employees on how to make it affordable. And that financial review committee is made of folks that aren't providers in that group, so it gives us a little bit of arm's length, but we're objectively looking at benchmarking pricing within the 3 hospitals to get a fair price, or a range for a fair price for the community. And then also maybe compare to Medicare what that pricing should be, so that we have a multiple of Medicare. And we're changing, hopefully in changing or influencing from a discount off charges negotiation, which has always kind of been the fee-for-service model in healthcare. And meaning if you charge $120, you get a 10 or 15% discount, well then what usually ends up happening is the price goes up to $135 and it's still $120, but you can say that you're getting a 15% discount. And that's kind of typical to what healthcare has been the last 20 or 30 years. What we're trying to do is use a reference point, whether it's Medicare or something similar to Medicare, as a starting point. We're not trying to do price control in the sense of price fixing. What we're trying to do is provide a fair value index, which gives you a range. What does Medicare pay? What does your highest insurer pay? And find a middle ground that each employer can negotiate then with the individual hospitals. That's kind of the strategy right now, but I think the neat part about it is it's kind of been the goal of the VHA to find a way to provide a fair value so that we have that homeostasis for sustainability. So price of care doesn't become a barrier to care.
So we have a few more minutes. Chris, do you have more to present?
That's it. Thank you. Thank you for the opportunity.
Oh, thank you so much. Okay, well, with that, we will.
Kelly's got her hand up.
Oh, Kelly, do you have another question? Thank you.
And also, Francie, just so you know, your screen is dark, so grassroots may need to troubleshoot during the break. Chris, I'm wondering on that latter point, you sort of hear a lot of comparisons of like percentage of Medicaid, and that's how charges are compared. When you're looking at the value, is that going to look different based on the type of service, or are you guys shooting for sort of an overall percentage there? Or is it more like, well, we know these services are going to be just more expensive based on what they require, and so their percentage of Medicare is going to be a lot higher than something else?
Yeah, there are services in rural healthcare that cause all services to be more expensive. So for instance, cancer care or cardiac care. is expensive, and when you have low volume, it's very difficult to pay for. So it gets spread across all the services. But what we're trying to do is simplify it to the point of average cost or average payment, or what they actually are paid per code. So instead of trying to, how much do you charge? Charge, because of all the different variations, charge is a nebulous, ambiguous term, in my opinion. So if we can come up with a way to look at what you actually get paid on average for each code, and that average would mean the highest private insurance and the lowest Medicaid or CHIP plan, and then in the middle is the average of all those, and that's how they manage their business and do their business. And then it helps us, give us a reference to where it compares to each of the hospitals. So we look at transparency, and we can price shop for that particular code or that particular procedure. And then based on that, we start getting a better reference of what a fair price should be, or a fair value. And then you can provide a range. It doesn't have to be price fixed, but get a better idea. I mean, in a perfect world, if we had a single price rather than all these different prices, because it depends on what insurance you are, what you pay. So we're trying to make it as simple as we can and bottom line it down to the simplest item.
And I have familiarity with that just as a user of Pickens County's insurance. I'm wondering if people who are individual, they're not part of this employer group, are they having access to the same information? Like, are they able to make those decisions about shopping around as well if you're an individual who's come through Connect for Health or something?
So there was a mandate to all hospitals for January 2021 to post all their charges, and they had their top 75 or 150, whatever it is, charges, but there hasn't been real enforcement by Medicare, Medicaid, or federal agencies to make the hospitals, post that. So it's really up to the hospital, the altruistic nature of the hospital, how transparent they wish to be. And so what we're trying to do is create greater transparency. And I think there was another level of mandate to help it be more specific about what they show, and then it still comes down to enforcement. And I think what has always been kind of the tone and tenor of the VHA is, I view us as helping the hospitals become transparent rather than pushing them in a way that they don't want to cooperate. So our hospitals cooperate because we work with them to try to find a balance. We always are looking for a glide path, not a cliff. Maybe if we could push them to get their prices down to Medicare levels, that would make it cheaper, but probably wouldn't be sustainable for the hospitals. And so we have to figure out how to balance that. And the only way to do it is to educate what the real price is, and then find what the balance is for our community. Again, we want to take the price from being a barrier to care, because if it is, then people only engage the system when it's most expensive.
Right. No, I get that. So if I'm interpreting this correctly, it sounds like there's some movement, but that there's still kind of a gap for consumer advocacy in terms of seeing that information.
There are websites, and I think you can find them on our website, that compare pricing, and you can look at that. Again, if we look at Civic, which is the Colorado database for all claims, it's all claims database. It's Civic CIVHC, and they're out of North Denver there, and they've done a really good job. The trouble is, it's about 3 to 4 years behind by the time they get all the data in. So any improvement that has been demonstrated in the last 2 or 3 years isn't on their database. So it's very difficult to get a timely reflection of what we're doing. And part of our work, we're doing 2 things. Allegiance is our data, our TPA for 4 of our 6 employers. And it's a subsidiary of Cigna, but it provides claims data to our the CCA, the Community Care Alliance, which is our pop health management organization that's really helped us with a primary care system to be effective. And they are collecting that data, and we're working individually and together with Allegiance to get that claims data to help compare just our 4 employers in aggregate. So each employer can look at how they compare on claims to the aggregate, and thereby understanding what the true cost of care is. And that's what we're working on from the employer side. From the individual side, you've got to go to Connect for Health. You've got to get to rvha.org and look at those resources that are out there. There's probably 3 or 4 websites, and there's a good book if you want a reference for a good book. It says Never Pay the First Bill. It's by Marshall Allen. He used to write for ProPublica, and it's a really good book. You think it's about bills, which it is initially, but if you get into deeper, it talks about the true cost of care and what are all the contributing factors, and then it kind of arms the consumer to make better decisions. And that's really one of the impetuses with the VHA, is to help arm our community to understand what the true cost of care is and how best to navigate that system. And hopefully in that, facilitate an advocacy from our provider community, because that they need to become, we look at that right care, right time, right place, right price. Our primary care, our hospitals, our specialists need to become well-versed in how much it costs, so that our people, whether the self-employed or self-insured community or the individual community, feel like they can find the best care, the highest quality at the lowest price. And that puts a heavy onus on the healthcare system, but I think we've got to push for that transformation.
Any more questions, Kelly?
No, thanks. And thanks, Chris. I always learn a lot from you. I appreciate your work.
Yeah,
Thank
thank you
you.
so much, Chris. That was really great. I really enjoyed listening to that. I learned a lot. So with that, we will break for lunch, and I will see everybody back here at 1 o'clock. Welcome back to the work session of the Board of County Commissioners in Pitkin on February 22nd. Here it on excuse me, on Zoom with me is Greg Poshman and Kelly McNicholas, and I'm pretty sure Steve Child is going to join us in just a minute. I'm Francie Jacober, the Vice Chair, and we are going to continue now with staff community presentations. Actually, we're going to go, we are. And I think Lindsay is going to introduce Ross Brooks for us. Is that right, Lindsay? Take it away.
That's correct. Thank you, Francie. Appreciate that. Lindsay Maish, Director of Human Services. Nice to see you all today. Thanks for having us and making some time on the schedule. I'm here to help introduce Ross Brooks, who's the CEO of Mountain Family Health Centers, and he's going to talk, we have had Human Services in Pitkin County in general have had a rich history with Mountain Family Health Centers in terms of really addressing access to health care for those in our community who may have barriers, like maybe they don't have insurance or they're on Medicaid, or we didn't have Medicaid providers for some time. And Ross and his and Mountain Family Health Center have been instrumental to us in helping to address some of those needs in our community. You'll be able to see in the agenda item summary, without me going through it completely, just some of that history. And it will show you kind of how we've arrived here today. To give you all an update, most recently for us, public health used to manage this contract. And in 2020, when COVID happened, they reached out to Human Services and asked for assistance in helping to oversee this project. And we, of course, because we have such great relationship with Ross and with the work that he's been doing, and I think Nan has also been pretty instrumental in helping bring a lot of the services to this area. We, of course, were happy to help take over some of the oversight of that contract. When we got into it, we really started to see that there was this focus on some of the fiscal and financial pieces, and it wasn't really serving the clients or the intention that we were hoping to, that we would like to see, which is to really help serve those who are very vulnerable, who maybe don't have insurance or are on Medicaid, Medicare, things like that. So we worked with Ross over the last year and his team to propose a new model of financial oversight. And that's what he's going to do here today. He's going to give you the overview he'll do an annual update of everything Mountain Family Health Centers, specifically also in our Basalt office, and then also show to you this new proposed model that has been agreed on with other funders for this. So without further ado, thank you, Ross, for being here, and take it away.
Thanks, Lindsay, for that kind introduction. And Lindsay, are you able to share screen, or would you like me to share my screen with the presentation?
I can try. If you can do it now, that would be great, but I can.
And let's race to see who can get it first.
All right. You win.
All right, can folks see that okay?
Yes, we can. Thank you.
All right, let me just start the slideshow here. All right, well, thanks so much, Lindsay, for that introduction, and thanks to all the Pitkin County Commissioners for having us here today with Mountain Family. I'm Ross. I'm the CEO of Mountain Family Health Centers. I'm also a patient of Mountain Family Health Centers and have been for the last decade. And I'm excited to be here today to share with you what we do in community in partnership with Pitkin County, Aspen Valley Hospital, Eagle County, and many others. First and foremost, we provide access to integrated medical, dental, and behavioral health care for all in our community. Our mission is that we improve the health of our community by providing equitable and affordable medical, behavioral, and dental health care for all. For the last decade, we've provided those three integrated services at all of our clinic sites, including at the Basalt Community Health Center, which y'all have been great partners in supporting. We have 10 clinic locations across Pitkin, Garfield, and Eagle counties today, all providing integrated medical, dental, and behavioral health, with hub sites in Basalt, which is in Pitkin County, Glenwood Springs, Rifle, and Edwards. And then in addition, we have 6 school-based health centers, 3 in Basalt, 1 in Carbondale, one in Glenwood Springs, and one in Avon, Colorado. We're really excited about the school-based health centers that we've been able to open over the last year here, in particular in the Roaring Fork Valley. As I said, 3 in Basalt in the elementary school, middle school, and high school, 1 in the high school in Carbondale, and then our newest school-based health centers at the Glenwood Springs High School, which we just opened last August at the Glenwood Springs High School, ensuring that students have access to integrated medical, dental, and behavioral health in the community. So we've grown pretty dramatically as an organization, not only over the last 10 years, but over the last 4 decades. And one of the things I always like to celebrate is that we're the healthcare home for more than 22,400 folks across Pitkin Garfield and Eagle County. That's extraordinary growth done in large part in partnerships with counties, hospitals, funders, the state, and the federal government. The sobering part of that growth, though, is that we have thousands of people in our communities today, February 2022, who remain uninsured. I'm not talking about high deductible, unaffordable health insurance. I'm talking about no health insurance. So if you look at these pie charts here, the bottom right pie chart shows you the total human beings we've served over the last 18 months. Over the last year and a half, pandemic plus, we've served more than 22,000 folks, yet 9,500 human beings remain uninsured at Mountain Family Health Centers today. And I want to put that in perspective. This is a decade after the Affordable Care Act has passed. This is after 2014, when our state expanded Medicaid to vulnerable populations across the state. This is after the best of reinsurance legislation and other work by our state to try to bring health insurance within reach for our communities. We still have 9,500 human beings, our friends, our neighbors, our community members, our staff, who remain uninsured in our community. And we are hell-bent, or maybe heaven-bent, on trying to make sure that everybody in our community has access to care. If you look at some of the other parts of the payer mix, about 1/3 of our patients are covered by Medicaid, which is health insurance for low-income populations, pregnant women, or disabled populations. A little under 20% are covered by commercial or private health insurance, at about 19%. And then you'll see 3 to 4% are covered either by the Child Health Plan program and or by Medicare, which is health insurance for those who are age 64 and a half or older. I'll take a pause there, and I didn't ask Lindsay and team how you want to handle questions. So feel free to interrupt me along the way, otherwise I'll just keep plowing through here.
Hey Ross, could you just describe some of the labels on these charts? I don't quite understand. 18M and counter payer mix. What does that actually mean?
Okay, yeah. Thanks, Commissioner Poshman. Great question. So 18M means the last 18 months. In payer mix on the right-hand side there, that's the human beings, what type of health insurance they have. So 43% have no health insurance. 19% have private or commercial health insurance that you would either get through your employer or potentially you would buy that on the Connect for Health Colorado commercial exchange. CHIP Plus is CHP. That's the Colorado Child Health Plan, not Colorado Health Plan, Child Health Plan. And that covers low-income children and families who live slightly below 200% of the federal poverty level. On the left-hand side is the encounters, not the human beings. So the right-hand side is human beings. Left-hand side, that pie chart on the bottom left there is the encounters and the percentage payer mix of encounters. So for example, you can see that 30% of our patients are covered by Medicaid, but 38% of our encounters are for Medicaid patients. And encounters count anytime you have a medical visit with us, a behavioral health visit, or a dental visit.
Thank you. Glad I asked.
Yeah, thanks for the clarification. I live this every single day, so I probably blow through things that need explaining.
And yeah, so 9,500 is 43% of 22,400. Just double checking the math. Thanks.
That's correct.
I have a quick question too, Ross. So only 4% of the patients served are Medicare? Really? That's so
Yeah,
funny
great.
because everybody says we have such an aging population in this valley. You'd think it would be higher.
Yeah, that's a great question slash comment, Commissioner Jacober. That's been pretty steady for my 10 years at Mountain Family Health Centers, and I've been in the community health center movement almost 2 decades now, and that's a pretty steady percentage at most community health centers. I think there's a couple of reasons for that. We do have an aging population, but most of the healthcare industry is committed to serving the Medicare population. We view that as folks age within communities, our collective responsibility to serve those when they go on Medicare. I can't say that's always true for our low income, undocumented population, those that don't have health insurance, and the immigrant population. I'm not sure there's always a collective commitment to making sure that those folks have access to care outside of what we do and outside of what others do to make sure they have access to care. But it's kind of my long-winded way of saying we do a good job as a community of taking care of our seniors. But for low-income folks, there's significant barriers to access to care.
That was very clear. Thank you. It looks like you can go ahead. I don't see any other questions.
Okay. This is another slide that just shows you what health insurance looks like across our state, with the caveat that this is pre-pandemic data. So the percent uninsured in 2019 in our communities, Pitkin, Eagle, Garfield, and Summit and Grand are also included here, was higher than any other part of the state. That remains true as we're moving into the new phase of the pandemic, hopefully to the endemic phase of the pandemic. But we know this well. We have the highest uninsured rates in the entire state of Colorado. That's driven by a couple of factors. One is we have a large percentage of undocumented immigrants within our communities that do not qualify for state health insurance or federal health insurance and the subsidies that are provided for those programs. And two, up until recently, and I'll talk a little bit more in the future here about the good work of the Valley Health Alliance and what's happening there. But up until recently, we really didn't have a lot of choices in the commercial health insurance marketplace. For those buying individual health insurance, for a long time there was one choice on the exchange, which is not an open market, and therefore a lot of folks just cannot afford commercial health insurance. So those are really the two headwinds of why we have such high uninsured rates in our communities still today. This is data from last year from the Colorado Health Foundation, where they surveyed Coloradans across the state. And the thing that always sticks out to me here is that almost 40%, 39% of Coloradans in the last year during the pandemic postponed needed medical or dental care because they were concerned about the cost of that care. So we know that cost and unaffordable health insurance continues to be a significant issue for communities in need. The next slide will give you a sense of the social determinants of health. And these are parts of each of our lives that happen outside of the traditional medical clinic. There are things like access to affordable food, access to affordable housing, transportation. We ask our patients what their social needs are outside of what their medical, dental, and behavioral health needs are. And these two these two bar charts here give you a sense of food, housing, and transportation are the largest needs for our patients, in addition to access to medical, dental, and behavioral health care. The next slide gives you a quick sense of, shows you how many folks we survey. So this is medical practices and behavioral health practices across our 4-county region. That top red bar there are the folks that Mountain Family has screened for their social needs over the last year. More than 5,000 folks we've been able to screen, asking them what are their housing needs, what are their transportation needs, et cetera, et cetera. And you can see other clinics are working on growing how they're asking patients about what their social needs are as well. I share this because it's just really important as we think about the collective health of us as human beings and the collective health of the community. Much of our health happens outside of a medical clinic or outside of a hospital or outside of even our visits with the behavioral health provider. It happens in our daily lives, right? How healthy we are is a lot dependent on access to affordable housing, access to transportation, access to affordable and healthy food. and access to the lifestyle of why we all choose to live in these communities so we can get outside and play and enjoy the great Colorado outdoors. Okay, I'm gonna shift gears a little bit here and talk about where low-income people live within our community. So this slide here is actually a map. It might look like a rash to you, but it's actually a map. And it's got Pitkin County on the bottom there, Garfield County on the left-hand side, and Eagle County on the right-hand side, with the zip codes drawn in funky little figures there across the counties. You can see the 4 Mountain Family insignias there are 4 Mountain Family locations. The one circled in red is the BOCC clinic that you all help support and have supported for more than a decade. We look at where do low-income families live within our communities, and that's the market that we target at Mountain Family. We try to go where low-income people are so they can have access to affordable care. I want to celebrate that BOCC last year, the BOCC Community Health Center, served 69% of the low-income families and individuals. That's extraordinary. And the reason that's extraordinary is because back in 2017, we were serving about 25% of the low-income families in Pitkin County and southwestern Eagle County. Our partnership with you in the expansion of the BOCC clinic in 2019 has helped increase dramatically the percentage of low-income patients that access Mountain Family's BOCC clinic. So I want to highlight that and also just say thank you for your partnership, because that's a real success story of expanding access to care for those most in need. You can see a little bit of the other data there. Glenwood Springs, where we've been around since 1998, we serve 89% of the low-income families. Carbondale, we serve 62% of the low-income families. In Rifle, we serve 61% of the low-income families. We define low income as 200% of the federal poverty level or below. And in real dollars, that's about $25,000 a year or less. For a single individual, is about $50,000 a year or less for a family of 4, which I think we could collectively agree is not a sustainable living wage anywhere in our communities. That's our target market, and that's who we work darn hard to make sure we're providing access to care to. So there's the success stories on the first end. There's also room for growth and opportunity for growth as well. We're working very closely with our Eagle County commissioners to expand our clinic in the Edwards market. You can see there in the Eagle River Valley, there's thousands of low-income folks that don't use us. But I also want to plant a seed for the future that in Aspen today, there are 1,400, almost 1,400 low-income folks that don't use Mountain Family. Not for us to solve today, but I think for our long-term vision and thinking with each other, we need to be thinking about how are we either providing transportation options so that Aspen low-income families can get down to the BOCC clinic, and or are there other partnership opportunities for the future where we might be able to bring Mountain Family Services up Valley into Aspen. Okay, I'll take a pause there and just see if anybody's got any other questions before we move into Mountain Family BOCC today.
Kelly.
Okay, yeah, I can't see the, oh, now I see the hands. Yeah, Commissioner Nichols Curry.
Yeah, hi, Ross. Thank you.
Hi.
I guess I'm curious how do you identify the sphere of all the low-income families? Like it makes sense to me how you would know which ones are using Mountain Health, but how are you associating the larger population?
Yeah, great question. So we have this really nerdy tool that I love called the udsmapper.com. And it provides data using census data, American Community Survey data, to project where those who live below 200% of the federal poverty level live. It's being updated right now with the 2020 census data, but it's a free online tool that anybody can go online right now. And you can see for every single zip code, how many low-income families live in that zip code, how many of them are uninsured, how many are likely covered by Medicaid or commercial health insurance. And so we use that, and then we put our real data on top of that. So for example, in Aspen there, we use the real zip code of service for our Aspen patients. And then we look at how many of those were served by us and how many of them remained unserved by us, did not have a visit. I think one of the limitations of this data, even though I think it's really cool and I love looking at it, is that it only takes on who does Mountain Family serve. So if folks receive services through public health or through a private practice that serves Medicaid or uninsured or CHIP patients, that is not reflected in this data.
Thank you. I look forward to exploring that tool.
It's super fun. You should play with. I play with it at night. So.
Greg?
Yeah, great. Thanks, Ross. I was just hearing your 1,400 low-income persons unserved by Mountain Family. Have you reached out to RAFTA regarding bus passes or something like that? I'm just trying to think transportation. If we're going to use transportation, it sure would be great if it was a bus and if it was free or no cost or low cost to the patients. And I'm just wondering, has anything been established and would that work? Would you consider that?
Yeah, it's a great idea. So we do today provide RAFTA passes to our low-income patients, to our Medicaid patients. Medicaid's a great program that helps support that. I think we can do better. There's more we can do there to make sure that, especially Up Valley patients, know they can use RAFTA and that they can get those passes from us. So it's a great idea. We're working on it, but we could do better to make sure that all folks know that they can hop on the bus and be down to see us in about 15, 20 minutes.
Great. Well, if you need any help, I'm the RAFTA rep for the BOCC, and certainly I would love to help out if you need it. Just let me know. If you didn't know, now you do.
Okay. Yes. Thanks, Commissioner. Looks like Commissioner Child has his hand up as well.
Hi, Ross. My question has to do with the 1,400 unserved in Aspen and the capacity in Basalt. If all 1,400 of them showed up in Basalt looking for service, do you have the capacity in Basalt?
Yeah, great question. The honest answer is no, not today. We've got capacity to take on about 700 additional patients right now. But part of our current challenge is that the Great Resignation has hit us like it has hit every healthcare provider across the nation. And I really want to hold up our heroic providers and care teams and all the work they've done, and I'll do that here in a minute with some additional data. But we've had almost 30% turnover at Mountain Family over the last year, which has been pretty crushing. Historically, we had about 11, 12% turnover, especially in our providers, and we've lost almost a third of our staff in the last year. So over the long run, yes, we will have the capacity to serve more folks in the Aspen market, but today we don't, just because we are so understaffed and really trying to encourage providers and staff to come be a part of the Mountain Family team. Great question.
Greg, your hand is still up. Do you have another question? I don't think so. I think you can go ahead, Ross. We're looking forward to hearing more.
Okay, thank you. And I'm wondering if our Basalt Site Medical Director, Emily Borkovic, has been able to hop on with us. Anybody see her or could let her in?
I do not. Do you?
Okay, if not, I will continue here. And if Emily joins us, she can hop on the call with us here. So this is what Mountain Family Basalt looks like today on Palindrome 2/22/22 day. As I mentioned, significant growth in patients served since 2019 when we opened the Basalt Clinic, 42% growth in patients receiving medical, behavioral, and dental health care services. A strong focus on low-income families, the vast majority living below 200% of the federal poverty level. In Basalt, 38% of the patients are uninsured today, and 32% are either covered by Medicaid or the Child Health Plan program. We looked earlier at the 9,500 plus low-income uninsured across Mountain Family. In Basalt in particular, there are more than 1,600 uninsured patients today. More than half are Latina or Latino, and I always want to highlight the strong ongoing collaborative partnership that we have with Pitkin County, Eagle County, and Aspen Valley Hospital in support of the uninsured. And I'll talk momentarily here about what that model looks like. Some of the items that I really wanted Emily to be able to highlight, and I'll highlight on her behalf. The Basalt Clinic and all Mountain Family Health Center clinics are recognized as patient-centered medical homes.
Ross,
by the
she's on now if you want to turn it over to her.
Okay, awesome. Emily, are you here? Okay, yeah, I see Emily there. Welcome, Emily, our Basalt Site Medical Director, and I'm going to turn it over to Emily to walk us through the next couple of slides here.
I don't see her. Oh, there it is.
Yeah, so sorry about that. I think we were in as participants, but not, we weren't able to speak. So we've been here listening to you, just so you know. Yeah, so kind of a picture of Mountain Family and the Basalt Clinic is that we are a patient-centered medical home, and while we are understaffed with providers, we're finally fully staffed with, we have a dentist on site, 2 behavioral health providers, and 2 medical providers. So we, at this point are functioning fully as a patient-centered medical home. And have, number 2, a Tier 1 status with Rocky Mountain Health Plans, which in order to meet that Tier 1 status, we have certain quality measures that we have to meet as a site and as an organization. We do have bilingual, bicultural staff, more than 50% of our staff, and I'd say the percentage in the Basalt Clinic is higher than 50% are bilingual, and mostly because about 70% of our patients in Basalt are Spanish speaking only. I think Ross has already kind of touched on the number of uninsured patients that we're seeing, and how we're seeing that percentage increase. Every time I see one of those pie charts, that number is higher, even despite the expansions with Medicaid. So that's very significant. And we do offer a sliding scale, a sliding fee scale. So we have an enrollment team. We have one dedicated person in our office here in Basalt who meets with patients, goes over their financial information, and if they qualify for our sliding fee scale, gets them set up with that, which is extremely, I mean, it's a huge asset for our patients who are low income. So it applies to up to 400% of the poverty level. And so this slide mentions that a lot of our patients can get care, and really complex, expensive care at that for as little as a $20 or $30, $40 copay. And then the governance of Mountain Family, our board of directors is 64% patients, and 64% women, 41% Latinx. So this slide shows us we call this our smiley face chart because it's easy. And so this shows us our quality measures, and pretty obviously the red is where we're not meeting the measure. The green is where we're meeting or exceeding the measure, and then yellow, we're somewhere close to the goal. And yeah, it kind of shows for 2021 the progress that we made. It was extremely difficult in 2020 and 2021 to meet some of these measures. It is really difficult to do cervical cancer screening when you're not seeing patients in person. It's really difficult to prove or show that your hypertensive patient is controlled when they're not coming in to get their blood pressure checked because of a pandemic. And even things like documenting child weight assessment and counseling, because of the amount of telehealth that we were doing, and it just is difficult to get those things documented. So we made some huge progress making up for lost time in 2021 to improve those measures.
Thanks, Emily. And if I could as well, I just want to highlight the Basalt Clinic in particular. The right-hand side of this smiley face chart shows you how Basalt's performing compared to Mountain Family as a whole. And Basalt consistently is one of our highest performers when it comes to quality outcomes. So I see Emily and Story there. They're probably being humble here, but I really want to lift up the team for providing high quality care and really leading the way amongst Mountain Family. In addition, as you look down at the bottom of this slide, this shows you how we're doing for our Medicaid patients in Pitkin County specifically. So these are key performance indicators around well visits, around access to dental care, and around emergency department usage. And I want to highlight the BOCC Clinic for being in the green and being a regional leader, not just a Mountain Family leader, but a regional leader in terms of well visits, access to dental care, and then keeping people out of the hospital inappropriately by reducing unnecessary emergency department usage via providing access to affordable medical, dental, and behavioral health care. I'm going to go to the next slide, and I see Story there. And Story, would you highlight our COVID vaccination efforts?
Yes, hello. Can you hear me okay? Here in BOCC, we have given 6,325 COVID vaccines. We've been part of giving vaccines up and down the valley from Glenwood Springs to BOCC, giving vaccines in the schools to provide vaccines for families who could not make appointments, cannot come into the clinic, and who cannot be present for them to be able to give vaccines for their children. As Mountain Family as a whole, we've been able to give over 15,000 COVID vaccines across the valley, which has been amazing. And it's been a wonderful effort across the board. We've been able to give Pfizer, Janssen, and Moderna vaccines to all of our patients.
Thanks, Story, for highlighting that. I'd like also just to highlight that of the vaccines we've given, when folks have disclosed race or ethnicity, more than 70% have been for folks of color, our Latina and Latino population in the community. We think that's really important from an equity perspective in the community. All right, thanks so much.
I just want to say real quick, Greg here, just want to say that's amazing. You guys have done amazing work there. My hat's off to you. I know how hard it is to reach out and to make it happen, and those are incredible numbers. Thanks.
Thanks, Commissioner Bushman. And hats off to the team, especially to Story. She's been working nonstop in the schools and in community, making sure that we're vaccinating folks.
Yeah, that's awesome. So this is regardless of citizenship or any kind of documentation, people can just come in and get care. Okay.
That's correct. Our vaccines are free to everybody, and we provide service, medical, dental, and behavioral health, regardless of documentation status, income status, what have you. Of our uninsured today, Commissioner Jacober, probably about half, if not more, are undocumented folks in the community. We do not require that documentation. We do require folks to disclose what their income is to us so that we can appropriately put them on the sliding fee scale and give them the discounts based on how much money they make.
Okay, great. Thank you.
All right, thanks all. I'm going to move us to the next slide here, and I believe our Director of Development, Jan Jennings, is with us as well. And if somebody could please put her on with me for these slides, and I'll ask both Emily and Story to chime in as well. I always think it's really important that we live our first name. We are a community health center, and so it's important that we be in community and serve our community. And I like to highlight some of the ways in which the BOCC Clinic and Mountain Family as a whole is engaged in the community. Number one is with the Valley Health Alliance, which is really focused on advanced primary care and total cost of care within our community. I think you heard from Chris McDowell earlier today, our partner in the Valley Health Alliance, and I really want to celebrate the good work of the Valley Health Alliance, especially around getting folks access to affordable health insurance. Last week, I heard that more than 3,000 people from Aspen to Parachute had enrolled in the Rocky Mountain Valley product, which is a commercial health insurance product that the Valley Health Alliance has helped bring to bear. That underscores what I was talking about earlier when I said there were very few competitive choices within the commercial health insurance market. The Valley Health Alliance has helped change that tone and tenor and brought good old American competition to bear so that health insurers can start to compete with each other and try to drive prices down for consumers, for businesses, and for individuals in the community. So big kudos to the Valley Health Alliance. We're pleased to be a part of that. West Mountain Regional Health Alliance is really focused on the social determinants of health. That data I showed you earlier today, looking at the housing needs, transportation needs, food needs, much of that runs through the West Mountain Regional Health Alliance and our partners around that table. The Mountain Voices Project is a broad-based grassroots community organizing effort that is really starting to hone in on affordable housing and mental health care access within our community. So we're engaged with that group, really listening to what do people need, and in particular, what do our immigrant communities need? What do they? What are the barriers for access to affordable care amongst our immigrant communities? Sync up in the National Institute of Medical Assisted Advancement. We're starting to get into the high schools to inspire folks to become medical assistants and to serve at Mountain Family, to become behavioral health advocates, to work in our billing department, and someday to become a nurse or a physician or a dentist or a dental hygienist. We think it's really important to lift up people from our communities, from our high schools, to be the future workforce at Mountain Family Health Centers. We've got a couple other partnerships with Reunion Health. We're pleased to be focusing on Sol del Val, focused on outreach and public messaging within the Spanish-speaking community. And we've recently rejoined the Aspen Chamber Resort Association so that we can be working with local businesses on access to care. If Jan's been able to join us, I'm going to ask her to say a few words about the health.
She is with us.
Thank you. So sorry. I had a bit of a problem I could hear everything going on. I just had sorry about that.
That was our mistake, not yours.
Thank all of you and let you know that we've been working hard. We inaugurated our Health for All Fund, which is our annual fund that is helping to cover care for the uninsured and all of our critical clinics and integrated healthcare. We've raised over $800,000 from the 2020 Rescue Fund, housed at the Aspen Community Foundation. We're the largest grant recipient. In addition, our Health for All Fund, we've been trying to raise about $225,000 each year, and we have come quite close to that or have exceeded that, along with instituting founding members, because we want to try to build the financial stability for Mountain Family Health Centers, kind of similar to our patients. Once they become a patient of ours, they usually become a patient for life. And so we really want to help sustain Mountain Family Health Centers with a healthy Health for All Fund, in addition to the many grants that we receive as well. But truly, with our Health for All Fund, we are able to welcome all patients to Mountain Family and more.
Thanks so much, Jan. I remember the last time we were all together, I think Commissioner Poshman did like a Facebook fundraiser for us right afterwards. And thanks, Greg, for doing that. I think we raised a couple $1,000s that we were able to reinvest back into the uninsured community. Appreciate all of your support. Okay, I'm gonna keep moving because I know time is tight here. So just a quick recap. The challenges that we see are high uninsured rates in the counties we serve. Total cost of care remains high, and many folks delay care or avoid it altogether given the price. Concern about affordable housing and exhaustion within the healthcare industry. And then the public health emergency at a federal level, God willing, will come to an end at some point likely this year. While that is generally a good thing, what that means for Medicaid enrollment is that Coloradans will lose Medicaid coverage over the coming 6, 9, 12 months ahead. We're concerned about that for a couple of reasons. One is we want to be in partnership with your teams to make sure that anybody who potentially could lose Medicaid gets re-enrolled in Medicaid if they're eligible to be re-enrolled. Two, to make sure that folks get connected with commercial health insurance, affordable commercial health insurance, if they do come off the Medicaid program. And three, if they don't qualify for commercial health insurance or for Medicaid, we want to make sure they get on Mountain Family's uninsured sliding fee scale. The opportunities is to continue to support access to care for all in the community, continue our strong partnership with you all, for which we are very grateful, and to continue to improve the population health outcomes. As you heard from Emily and Story, that the BOCC Clinic and all Mountain Family Clinics work hard to improve the total quality outcomes in addition to controlling total spending in the community. Lastly, I'm going to close with the new uninsured per member per month model that we've developed in partnership with you. So as you heard from Lindsay as we started, y'all have been our partners for quite some time now, supporting not only rent, but also what historically was called an uninsured operating subsidy. This year, last summer, we started planning for how do we shift that from a loss model into an asset-based model that helps pay for human beings and helps pay for high quality care for those human beings. So given that there are more than 1,600 folks at the BOCC clinic who remain uninsured today, we've struck a partnership with you and evolved our partnership with Pitkin County, Eagle County, and Aspen Valley Hospital, where all you have agreed to serve as what we call the payer of last resort for the uninsured within the community. First and foremost, with every patient, we want to try to get the patient on affordable health insurance. So we work hard to try to get you enrolled in Medicaid or Medicare or CHIP or an affordable commercial health insurance plan. But given so many of our patients remain undocumented or can't afford any of those products, we still have many patients who remain uninsured. We try to leverage every federal dollar for those patients, every state dollar, and every local dollar. But at the end of the day, we still, as you've seen, we still have thousands of uninsured people in the community. So how we've shifted the reimbursement model is that Aspen Valley Hospital, Pitkin County, and Eagle County have agreed to what we call an uninsured per member per month payment to support the human beings that use the BOCC clinic for medical, dental, and behavioral health care services. This year, that's budgeted at $23.33 per member per month. You all help support that as the payer of last resort for those uninsured patients to ensure that they have ongoing familial access to care at Mountain Family. The way that it's split between the partners based on historical documentation is the hospital picks up 51% of the tab, Pitkin County picks up a little over a third, 34% of the tab, and then Eagle County, given we serve the BOCC clinic serves patients from the southwestern corner of Eagle County, they pick up 15% of the tab. We continue a annualized budgeting process, quarterly reviews of our financial performance and quality outcomes with those three partners, with Pitkin County, Eagle County, and Aspen Valley Hospital. And with that, that's a lot of me blabbing. I'm going to turn it over to the commissioners for any questions or comments. Thanks so much for having us today.
Thank you, Russ. It was really informational. Greg.
Thanks, Ross, and thanks, Francie. First of all, this picture is great because I see so many people I know from so many walks of life in this photograph. Maybe I'm in there, but I was too short and in the back, clearly. The question I had was, the last slide you showed, I'd love to see the numbers. I mean, the actual numbers. It comes out to about $448,000 per year in subsidy needed. Pitkin's shares of 34% of that, so we're looking at $150,000 a year. Is that in cash or is that in rent? Is that how I'm trying to remember how the relationship worked.
Yeah, part of it is in cash for the uninsured patient population, and then part of it is I don't think actually Pitkin County pays any of the rent because you own the space.
We're the landlord, right?
You own it, and you've
given rent.
Yeah, you've discounted the rent already below market rates. So it's really a cash outlay from Pitkin County's perspective. For Aspen Valley Hospital and Eagle County, they pick up a portion of the rent and the uninsured PMPM.
Great, thank you. Well, it's good to know. It's good to have an idea of what that number is per year. And we're looking at $450,000 a year in subsidies required for the uninsured there. Thank you.
Yeah, great question. I'll make just one comment on that. You know, if we as a nation decided that health insurance and healthcare was a human right and we were going to cover everybody within our nation, we don't have this problem. But we have not made that decision yet. And so thank you for being our partners to make sure that low-income uninsured have access to care until we decide to move to universal health care coverage. Editorial over. I'll shut up for more questions.
Kelly?
Looks like Commissioner Curry's got a question.
I do, and I'll comment, apparently in nations who do have that coverage, the whole pandemic has been far less stressful than it has been here. Can you explain a little bit what the shift with the loss in Medicaid coverage, I guess two questions there. What will happen for folks who are going to fall off of Medicaid? What are the efforts going on? And then what does that do for this payment per patient model?
That's a great question. So I think there's going to be a couple different prevailing winds battling each other as we walk through these shifts. And I don't pretend to know perfectly how it's going to play out. But as you heard from Emily, we're seeing the uninsured grow already today. Technically, what will happen when the public health emergency comes to an end, when the feds formally declare that, states have 90 days to figure out how they're going to start to redetermine everybody who's on Medicaid. Our state has said that when that announcement is made at the federal level, they're going to try to go through a 12-month process to do Medicaid redetermination. So the good news is that people won't lose Medicaid overnight, but over the period of a year, the state, and working with the counties, so working with Lindsay's shop and others in human services across the counties, are going to have to redetermine those folks that got on Medicaid during the pandemic, because during the pandemic, nobody could be redetermined, so you basically couldn't get kicked off Medicaid during the pandemic. Bottom line is we don't know perfectly, but I've heard from the Colorado Department of Healthcare Policy and Financing that up to 260,000 current Medicaid enrollees will be up for redetermination. That's out of 1.6 million total Medicaid enrollees today, so I can't do that math. 17% of Medicaid enrollees will be redetermined and potentially will lose Medicaid coverage. So first and foremost, we want to partner with you to make sure that anybody who's up for redetermination knows that, and we help them get re-enrolled in Medicaid, assuming they still qualify. Some folks will make a little bit too much money to qualify for Medicaid, and it's not like you're rich, but the Medicaid cutoff is 138% of the federal poverty level, which I'm trying to remember what that is in real dollars today, but it ain't much. Probably like $16,000 a year is the Medicaid cutoff for a single individual. So some folks are going to make a little bit too much for that. They're not going to qualify based on their income for Medicaid. For those folks, we're going to try to help get them enrolled in affordable commercial health insurance. And again, kudos to the Valley Health Alliance for putting together the Rocky Mountain Valley Health Plan. We'll try to help those folks get enrolled in that, or if Anthem's a more affordable product for them, we'll try to help get them enrolled in that. After those things, though, we're still concerned that a big chunk are just going to be uninsured again. And I don't know what percentage, but I'm going to say at least half are probably just going to become uninsured again. And that's where this per member per month comes into play. We'll continue to report this out quarterly to you all as partners. But I'm concerned that we may see the uninsured start to grow every quarter, especially after the public health emergency comes to an end. And what that means financially is that you all as partners would be on the hook to help ensure that those folks have access to care. That $23 would apply to every individual who becomes uninsured. But I don't want to discount the fact that we're going to work like heck to make sure we get everybody enrolled in Medicaid or commercial health insurance we can. But we're concerned that lots of folks are going to become uninsured again.
Thanks, Ross. I mean, I'll just say, we heard a really compelling presentation last week about the cliff effect of the folks in the community who are not making, are not eligible to receive benefits and will not make enough money to pay for things like health insurance and medical coverage. And so I'm glad there's a system in place which people can continue to get care. And, we will review how we are paying for it and what those payments look like. But to me, that's an important gap that's already closed, that folks who need care and should, continue to access care will be able to. So thank you.
Thanks, Commissioner.
Steve.
So Ross, at the beginning, you mentioned the programs in the schools. And I notice you have all three of the BOCC schools covered, but you only have the high schools in Carbondale and Glenwood. And realizing this is new, do you plan on expanding into the middle school or the elementary schools there? And what sort of services do you provide in the schools? Is it more just for the students, or does it capture the families, the whole mom and dad of the students. Could you describe that a little bit, please?
Yeah, thanks, Commissioner Child. Great question. So the services are integrated medical, dental, and behavioral health care services in the school-based health center, very analogous to what they are in our integrated community health center system, like in the BOCC clinic. We have struggled actually to staff up until this point, more for the behavioral health services. So we're doing a lot of work to try to make sure we get the right behavioral health providers there within the schools. That's due in part to the Hope Center's doing an awesome job in our communities. So I really want to lift up the Hope Center. They're doing great work within the community. It's a little bit of a challenge for us because we've had a little bit of trouble staffing behavioral health. The big picture, we provide medical, dental, behavioral health. It's focused on the students and on their need to access care within the community. That really is the focus. For families and for staff and for parents, we'd really like those folks to go to our hub community health centers, in this case in Basalt or in Glenwood Springs. That's not mutually exclusive, but that's really our intent, is that it's focused on students, that it's safe for students in the community. Your first question, Steve, was about where are we going to expand to? I think we probably will not first expand to like the Carbondale Middle School or elementary, or Glenwood Middle School or elementary. As we think about the fact that there are 1,400 low-income individuals in Aspen that don't have access to care, I would be more interested in potentially trying to partner with the schools in Aspen, be it high school, middle school, or elementary school, when we think about potentially bringing Mountain Family up Valley. And then as I think about the rest of Mountain Family's communities, certainly areas like Parachute or Gypsum in Eagle County are really low-income communities that I think, if and when we're ready to expand school-based health, we'll probably ask to go to Aspen, Gypsum, and Parachute.
Okay, thanks.
Any other questions for Ross? Ross, did you have anything else you wanted to tell us about?
I just want to say thank you. There's some, I think, really interesting appendices here, but just thanks for all of your partnership, for your work, for your resiliency through a hellish last 2 years. I do love this picture because there's lots of great people. I love seeing John Peacock's dog Blue, who is the unofficial mascot of the Basalt Clinic, and many of you all as partners who have supported what we do at Mountain Family and continue to support what we do. So thanks for your support, and thanks for your service as elected officials in the community. That is not always easy work, and we appreciate everything you do in Pitkin County.
Well, thank you, Ross. We are lucky to be in this position to be able to help you all do what you do. Really appreciate your presentation.
Have a great day. Bye-bye.
And next we have a housing update from Cara. And is she with us? There she is. I think she's with us. So
she was just joining, Francie. She's probably getting there she is.
It's all you, Cara.
Well, thank you. I apologize. I was watching the stream and forgot it was a little bit delayed. So I apologize for that. Well, thank you everyone for having me. I'm not sure Nan Sundin may be able to join or may not, but wanted to come to all of you today with an update on housing and really where we are with the Roaring Fork Roadmap and the Housing Coalition efforts. And so what was provided to all of you in your packet was some information about where we are currently in a regional housing. And so just want to take a moment and take a step back, which was last fall we did stakeholder meetings, as you all may recall, from the roadmap process. And one of the key things that came out of that was community housing is a top priority, meaning it follows the entire spectrum, the entire continuum of housing, and really a need to be working on it at a regional level. And at the same time, the Housing Coalition that was put on pause from 2019, that was spearheaded by Bill Lamont and David Myler, started to reconvene as well, as everyone started to recognize that housing crisis is only getting exponentially more of an issue as we come out of COVID or whatever the state is that we are in right now. And so as we started working together, we had the coalition steering committee was moving down a path to see what their future was, and the roadmap planning committee was coming to a path as well of how do we address regional housing. And so we came together and recognized the commonalities and how we could leverage one another's efforts to see what a path forward is. And so what is before you today is an invitation basically from the Housing Coalition and the Roadmap Steering Group, for lack of a better term, to join a letter of intent to stand up a regional housing nonprofit entity. And really what this commitment is it's to provide $10,000 in seed funding to go towards that nonprofit. We know that there's probably going to be more requests down the line coming, but really this is just showing at a regional level all the different entities have a commitment, recognizing that this regional housing effort is necessary for where we are, and is really giving that autonomy off to this nonprofit entity as it gets formed to help address housing issues in our area. And so, as was in your packet, we outlined some of the benefits of what the group is looking at, and it really is, as you may recall from 2019, there was discussions about this being a housing authority, or then it was an informal group. And as we started to look through the path that we are today and discuss across the region, we recognize that having a nonprofit formal entity is a benefit to our region for a couple different reasons. One is that it is a little bit independent of any one government, and from, it doesn't have that location and extent. It's not an actual government entity, but can do some really innovative things. And second, there's a lot more, but the top two ones. Second is that with the $450 million that are coming through the ARPA funds at the state, roughly half are grants and roughly half are loans. As we learned, the loans require any government entity, because of Tabor, will likely have to go to a vote in order to access any of those funds. Nonprofits are much more poised to access those, and so having a nonprofit on behalf of our region, hopefully if we have some projects or have some key areas identified, might be able to access some of that funding that, quite frankly, wouldn't have been available to us otherwise. And so that was the mutual benefit across all the different partners to recognize, yeah, this is a path, and we'll see how it heads. So that is really what the request is. This is a letter of intent. It's really just a commitment to try and form a nonprofit, and showing that we are interested and believe that regional housing is a path forward, one of many paths forward, but one of them to take, but is not necessarily a commitment of who sits on the board of directors or anything, just that we'll be working on that governance structure. So I'm going to pause there and open it up, because I'm sure there's a lot more questions than me talking.
I'm going to jump in. Francie had to run to the restroom and ask that I chair in her absence for the three of us who are still on. So Greg or Steve, questions for Kara at this point? Steve, go ahead.
Well, Kara, I remember the days when the whole effort of the group with Dave Myler was to create the multi-jurisdictional housing authority in the Mid-Valley. And so this is just a coalition, which means that we would be working in cooperation with the different groups down Valley, and perhaps participating with them in some projects or not. Is that kind of what you foresee?
Yeah, it's kind of twofold. this is really actually to say we're bought in and supportive that there's a regional nonprofit to address housing for the Roaring Fork Valley, and that maybe there's times down the road that we disagree, but we agree that this nonprofit needs to stand up. And then the twofold part of it is, as we continue with the roadmap process, we're actually using those state resources to update the 2019 regional housing study and come up with actions that we can take as a region, with the idea that really then this nonprofit becomes an arm to implement those actions. So there may be some things that are Pitkin County specific, but there might be some things that are across the region, and we would look to this nonprofit to really be the implementing arm of that effort.
Yeah, and I think if there's a success in a down valley entity and creating more affordable housing, that kind of lifts the whole boat in the whole valley. It helps us out, even though it's not specific for Pitkin County employees. Some of them very likely would be employees who work in Pitkin County. So I can see supporting efforts all up and down the valley and in creating affordable housing.
John?
Thanks. And I just wanted to add on, Steve, to what you're saying and Kara's response, that we actually were one of the entities that had concerns about a housing authority being created because of the locations and extent review capabilities. And so it had switched, the strategy had switched to a less formal housing coalition, but that wouldn't accomplish the goal, as Kara had said, of being able to access the Senate Bill $242, the kind of generational housing funds that are coming down the pike, some in the form of loans. And so the conversation has really evolved to this nonprofit structure on a regional basis to address our concerns, but be able to take advantage of this generational funding coming down. So we think it's a really, from the staff perspective, we think this is a really good solution.
Let's see, I think Greg was next, and then Kelly.
Yeah, thank you. Yeah, this is exciting, and I was recalling those conversations we had earlier, just about control. What if we put the money in, but we lose control? Is usually an issue like that, and this seems to make a lot of sense. So I'm enthusiastic about it, and I can't wait to hear more. The governance is a conversation, which reminds me of the conversations we've had over at CORE, because CORE is doing something very similar. And so maybe we can all learn from this process together. Thank you. And Kara, thanks for keeping on this. This is good.
Kelly.
Thanks. Okay, I'm glad to be responsive to this issue. I want to ask, I think, maybe some more difficult questions, because I'm wondering, how do we argue this to someone who says, well, this is just an end run around the taxpayers? How do we defend that there if this is a coalition primarily of government entities who would otherwise need to go to the voters for projects? And that's my first question.
Well, I think the short answer is the state has established that process. The state, by putting those out as low interest loans to nonprofit entities or local governments. We know local governments are out of that, so it's primarily to nonprofit agencies. Currently, urban areas tend to be ahead of rural areas, and so we are putting together a nonprofit that will allow us to access tax dollars on a more equitable basis across the state in compliance with TABOR. And so I don't necessarily see this as an end run so much as an equity issue, Kelly, I think is how I'd answer that.
So I think what would also help flesh this out is to understand who we'd be competing against. I mean, you know, that was a pointed question to pull out, I think, what some people will be critical about in the public about such an effort. I will say, you know, we have a real gap here in the mountains of providers of housing. So like you mentioned, I mean, urban areas have, you know, a load of nonprofit housing developers and things like that who are doing that on a private basis and don't require kind of government intervention. So who are we competing with? You know, Roaring Habitat for Humanity comes to mind. Who else is out there? You know, what is Eagle County Housing Authority's interest in this, except that they, you know, it's a second funding stream? Is there anybody else who's doing this? Is Catholic Charities doing this? Is, you know, what other organizations might already be in this sphere that such a nonprofit would be competing with funding for?
Happy to start, but maybe Nan or John probably have a better sense of it. I think one thing I would just maybe clarify on the competing terms is one thing we really heard from those stakeholder meetings too is a lack of regional coordination, and that there's not a mechanism to work on a regional level of maybe you access Eagle County housing or you access Aspen-Picken housing or Garfield, but there's a lack of ability to be mobile within our truly interconnected region. And so that was a big piece of, for staff, kind of that momentum behind it, is that this is forming that regional mechanism that maybe hasn't existed. Not to call out that there's not other nonprofits doing it, but doing it more as that regional across the jurisdiction. So I would start off with that, but then maybe defer to Nan or John of other housing nonprofits and how we work together and compete.
I don't know, I agree with that. This is really a regional mechanism, so that makes it different. And also, I think what we're learning is there isn't another one like it around the state that is involving this many jurisdictions and this level of interest. And that may be because we are a rural resort area, right? Together, we bring more volume and population and need in, but singularly, we have trouble competing with other counties around the state. So I think that's one thing, but also, and you all, maybe this isn't what you're asking, Kelly, but Eagle County has a nonprofit arm in their housing authority called the Home Store, and they are already a nonprofit. Garfield County already has a nonprofit called Uncle Bob's. We don't have one up here, as far as I know. Maybe I'm wrong, but this is an opportunity to pull in both of those partners, Uncle Bob and Eagle County. They want to be in on this because what they see is that there are unique opportunities for us as a region that would be different from what they will be doing in their unique community.
And then maybe I'll also answer, since we're all jumping in here, but Kelly, I'm reflecting actually on the previous two presentations you saw on healthcare in terms of the competition question. And what we tend to do is try and thread together sources and support. And so, you know, I think a nonprofit like this, which is more generalized and coordinating on a regional basis, will probably have more opportunities to draw down on that state funding to address affordable housing needs than particular, like Habitat, for example, which is an amazing organization we have amazing partnerships with, but it's a very specific model. And so this opens up more avenues for us as a community, as a region, to access these dollars and to fund these needs. And I fully anticipate that what we'd be seeking is partnerships. And one of the things that Habitat does is they are a developer. And so to the degree that this can enhance funding streams or opportunities, I would see the nonprofit operating more that way in the long run. But right now, we don't have that generalized, regionally focused, housing organization that we think will maximize our opportunities. And we think this is a better structure for that.
Kelly, did you have other questions?
Okay, thanks. I did, yeah. And I'll just comment, I have tough questions to ask here that I think are going to be important for this to be successful, but I do just want to interject and say that, Kara, in your earlier presentation, I don't know if it might have been the end of last year about the roadmap to recovery process. One of the things that stood out to me was in the interviews that said, are people working, is your government working on this, cross jurisdictionally? And I think the quote was, we haven't, we aren't, we won't. And that was like super, it just drove home for me, like, I'm not going to be like that elected who, refuses to look broader and partner and see the bigger picture and think of our community in a more broad-based way. So I do see this as the solution to that inertia over decades, and I appreciate and applaud the effort, and I just want us to get it right. And so I think, I'm glad to hear that the needs assessment will be updated. What I'm trying to pull out from some of the really difficult housing conversations I feel like I'm in our community right now is that we can have a very good sense of the need, yet there's a huge debate around who the government needs to solve the problem for. So, this is premature in this conversation, but this is one of those devil in the details of when we're all going to come together to try and work on this, that I just want to call out as being a really important thing to work out. And that to me, that's going to require a whole community process to work that out. Because I think the needs assessment is going to tell one story. And then when we get to the action items, we're going to have to very clearly prioritize together, well, whose need do we want to solve for? So I'll say that. And I think I had another question, but I forgot. So maybe I'll come back to Francie. Thank you.
All right, Kara, I have a question. And you may have covered it when I took a break just a minute ago, so forgive me if I'm being repetitive for you. But with the representatives, like the people, with the people who are being invited to participate, are they going to make up a board for this nonprofit, or are they just going to be contributing money? That's the first part of the question. And the second part is, will they be elected officials, or will they be people who are the elected officials invite to do this?
So let me go with the first question because I understand it first, but those that sign on to this letter of intent are committing to come together and form a board of directors that will guide the nonprofit. And so they are really have a seat at the table of what that governance structure looks like. I think to your second question, Francie, is we even debated this a little bit last week and realized we were getting a little bit too far into the details of, is it, Pitkin County sits in and then who's the person? And I think we all realized we need to see who's signed in on this and come up with the governance structure that works best for the region. So I don't think we've answered your second question of, is it a Pitkin County gets to designate someone that's a community member or a staff or elected? We have not gone down that far, but just that you're bought into coming up with a governance structure of a nonprofit that works for the that works for the region and provides that flexibility and adaptability that we don't have as a government entity.
Okay, and what is our timetable on this?
Yesterday. So it is going to jurisdictions today. In fact, it's going to Pitkin County, City of Aspen, Town of Basalt. Most people will be, it went to Glenwood last week, it's going to Carbondale and Snowmass and Eagle and Garfield in the next couple of weeks, with the idea that we want this formed and probably incorporated by April or May, so that we anticipate the funding through the legislative session will be ready around June or July, and that we are poised to be able to act on that.
Okay, thank you. It looks like we're back to Kelly. Or let's see, are you next, Greg? You go first, Greg, then we'll get back to Kelly.
Great, thank you. This is actually really exciting. And when you're talking about board governance structure, I'm sure you'll be thinking about, what is the mix? Is it going to be all electeds? And if it's all electeds, how is that going to work? And might there be unelected people on the board as well? And, the influences on them are different, as we all know. So it's a complicated thing. And as I said before, we've been kind of going through this with CORE, and a lot of fascinating things come up. So I'm hoping that you really dig deep in this. Will there be committees? Will we have an advisory board of, maybe a national advisory board or a council, or, this is a really interesting thing that's going on here. And I'm hoping as you're designing the board structure and proposing ideas to the other entities, that all those are on the table, because I think something really rich and wonderful can happen here. And I guess I'm a little bit wary of it being only electeds, because it gets political and sometimes it gets kind of clogged up. I hate to pick on EOTC, but I think EOTC is doing great now that we have Dave Esnashak. But there were times when it just felt like we were just kind of stuck. And so I really can't wait to see what you all come up with on this. Glad you're working on this, and I can't wait to see the results.
John, did you want to respond to that, or should we go to Kelly?
No, you can go to Kelly, and then maybe I'll share some thoughts on the governance structure and how, at least from staff's perspective, we might invite you all to think about it a little bit.
Okay. All right, Kelly.
Okay, I look forward to that, because I agree. I think we will get accused of being an end run around the public process if it's all electeds, and I think we should avoid that. My question was, I think last question at the moment is, have we thought to invite Parachute? Would they be interested in this?
Yes, so we have invited the Colorado River Valley. They actually came to a couple of our meetings, and there's agreement that we have momentum, and so let's move this, get this stood up. Anyone that wants to sign on and can come in at any time, and we're inviting them to come to any of our meetings, but we didn't want to wait for everyone to hold up the idea of getting started. But we have reached out to all entities in the Colorado River Valley.
Okay. Sean, go ahead.
Yeah, so just coming back to the governance question, I think, as Kara said, this is our initial skin in the game and creating a partnership, and we haven't reached any firm conclusions. However, I think one of the advantages of creating a nonprofit is to create an organization where you have a board that is as adept at solving the problem that you've asked them to solve as possible, and then really bringing solutions. One of the things I would not suggest is that this board just write checks to an organization that gets created, but that it's set up in such a way that the organization is bringing projects or recommendations forward that are so compelling that you want to be part of it, and that we want to commit to it financially, potentially with policy kind of support from the board. And that may be a board with some elected representation. It may not. And I think we're not creating an authority, which would typically be made up of representatives from elected bodies. It's a nonprofit. And so I'd really encourage, this board and all our partners to be open to how do we create a board structure that's going to bring the most compelling and relevant projects forward for our jurisdiction and other jurisdictions. Is we've been kind of locked by the politics, right, in our valley a little bit. So if we're doing an end run, it should be around that. It should be around how do we solve the problem in a way that creates compelling solutions. And I'm not sure, and that is no offense to any elected officials or bureaucrats, I'm not sure we're the right ones necessarily for that. And I hope we'll be open to that going forward.
Thanks, John. Steve?
I don't think we have to worry about this being an electeds only. Looking at the membership of Mountain Voices Project and all the nonprofits in there, there are ones like the Manaus Fund and the Valley Settlement, Habitat for Humanity. Different groups are, they're working on housing solutions right now, and I think all of them will probably be good candidates for serving on the board also. So I wouldn't worry too much about it just being all government representatives. I keep thinking of Bill Lamont and wishing he could be here to, be celebrating kind of the success of, making this baby step forward in creating this coalition, because he worked really hard on it with Dave Myler, and it's something, it's part of his legacy that can be, because he contributed so much to this effort. I just been thinking about him while we're talking about this, and I think he should be somehow recognized in this whole process.
Is that all, Steve? Do you have other questions? Okay, Kelly, back to you.
Okay, thanks. So regarding this location and extent thing, I think we should maybe call that out in the letter if it's not too late to do that as one of kind of the benefits, I think, because from the community perspective, I do think there's a real benefit to the assurance that projects would have to go through like land use approvals in the jurisdictions that they'd be proposed. Yeah, I just think we should detail that in the letter if we can, if it's not sort of too far down the track at this point, that would be important for people to know. And for people who are watching, that would mean it would be expected to apply by code and meet all the standards of the individual jurisdictions codes, et cetera. Thanks.
One follow-up on that, if I can, is we are trying to not edit the letter as it goes to 8 different jurisdictions, but if it's okay with all of you, I can take that comment as we work at the Articles of Incorporation and bylaws and put some language around it there, rather than trying to edit the letter of intent, if that's acceptable to all of you.
And did you have more for us, Cara?
I did not, but Greg has his hand up.
Only that you need us to approve you to approve and sign the letter of intent on behalf of us. And I'm giving you thumbs up.
Does everybody want to give
Yeah,
thumbs
so
up?
unless okay.
Go ahead, John.
No, I interrupted the board starting to roll on that question. And I was just going to say, we already have funds appropriated. The agreement is within an existing nonprofit. And so this was an opportunity for the board to say, staff, it's staff's intent to enter into this unless you all pull us back is really kind of why we wanted to present this and make sure that you are comfortable with this direction. And if not, then we will not be a participant. And if you are, we're prepared to execute. So you're on the right track. I think we had 2 of the 4 of you already responded.
Kelly, go ahead. You were going to say something?
No, I said I support it. Go ahead. Thank you.
Great. Steve?
Yeah, and I support this too. This is, I think, so much better for us. It's something we can support, whereas the earlier efforts, there were so many problems with the multi-jurisdictional housing authority concept that were just really insurmountable for us. So this one, I think, is doable. I think it's a good plan, and I support it.
Greg?
Oh, sorry if my hands, I'm in support.
Okay, great. And I am too. Thank you very much, Kara.
Thank you all. And I just want to call out, John and Nan have been huge in this, and Dave Myler is recovering from an operation. Otherwise, he would be here himself today, but he's in great spirits, and huge kudos to him for continuing to carry this forward too. It really speaks to his leadership as well. So thank you, everyone.
Thanks to all of you. It sounds amazing. We are due for a break. So let's take a 4 into 14-minute break and be back here at 2:40. Okay, so just look at that. Oh, you're wondering about the ad, are you? Welcome back to the Board of Commissioners work session meeting on Tuesday, February 22nd. We are back in session and we are going to have another staff presentation, and this one is about the infrastructure team update, and Rich will introduce it for us.
Thank you, Francie. I appreciate it. Board, Rich Engelhardt, Deputy County Manager, and in the room I've got Jody Smith, Dan Bartholomew, and then Jeff Kruger's going to join us online. He was tied up down Valley, or he would have been here as well. So what I'm going to do is share my screen with you. We've got a presentation for you all. It's an opportunity to get in front of you, kind of talk a little bit about what has taken place. I know there were some questions on the telecommunication side that Jeff should be able to answer for you, but an opportunity to bring you up to speed. And one thing I'm going to also have Dan do is that I'm sure you all had received an email. There was an incident yesterday at the airport, and he'll give you a quick update on that as well before he gets started with his. But I'll go ahead and get this started. All right, this is our infrastructure service team. Brian Pettit is out of town. David Besnicek, I think, is in front of you quite often. So he had asked for a hall pass, and so that left the rest of us here. So we'll go ahead and get going. One of the things we did during the budget process when we introduced our team is there were three real kind of main topics. And so just briefly to update on those, the climate action plan. This is where we're all coming together to put into effect and to carry out your initiatives that you have funded for the coming year. Well, where we're at is Kimley Horn has been selected as our consultant that's going to be looking at our facilities electrification process. We have kind of taken a little bit of a pause on that because of the connection not only with all of our facilities, but with the microgrid and also the Public Works master plan. They're kind of all tied together. So we're taking a quick pause on that so that we don't misstep or pay for something where we could have combined it together to make sure we get a better result for you all. So, but they have been hired. They're setting in the wings, and that's going to get started here pretty quickly. We are in the process of determining the best approach for the microgrid. As you all know, Zach left. We have not filled that position yet, so we're going to be meeting to talk about that as well. On the housing side, a lot of activity on our deed restricted and down payment programs, as well as the rental units that Jody manages for us. So we have purchased back 2 units, as you're all aware, and then we're currently participating with 2 employees on getting into the program. One of them is taking place in Silt. And if it wasn't for you all opening up those boundaries, I'm not sure what this employee would have done, to be quite honest with you. We're seeing a lot of the employees who are in a rental situation, and with the market being as lucrative as it is, a lot of the owners are looking at selling those units. And so this individual was renting, but has found a place, and with our work from home type system that we've got in place, that's, I guess, one of the benefits of COVID. This has worked out well, and this is going to pay off for that employee. We're also working with 3 others. I just sent out notice letters this morning, so it has really picked up. And then we just recently, you went through a process with Jody. In fact, I think you have a second reading on a number of leases that have taken place. So the housing activity has been really active for us. I did mention the Public Works Master Plan. We are going to link the microgrid and the facilities to that as well, but we're going to sit down with John and Phyllis and Karen and just kind of talk about how we advance all of these real big initiatives going forward. And I think the retreat helped give us an idea of your desire to move those forward. So based on that, we'll be meeting here rather soon. So those are just some quick updates on the 3 big ones. But what I'm going to do is turn it over to Jody, and she's got some slides to bring you up to speed on what's happening on the facilities.
Thank you. Jody Smith, the Facilities Director for the county. Oh, come on. I just kind of wanted to bring you up to speed on a few of the renovation projects that we're already in progress doing, what's been completed, and kind of what's happening for the future, and then a couple of other updates on the overall department. So kind of the biggest one that we've been working on for several years now is the courthouse renovation. As you know, we were in the ending phase of, we completed phase 1 and 2 before COVID hit, and just at the end of when that started, we put that project on hold, and it's been fully funded and projects are back in the queue. So the courthouse phase 3 project is about to get going again. I did recap here in the, let me move this thing so I can see. Okay. There was a design scope ad for the district courtroom for the 9th Judicial. We originally in phase 1 and 2 hadn't planned on doing that, but as we moved through the pause and we realized we didn't have ADA compliance and the judges, and there were some other needs, especially the infrastructure and technology that they really need. So we were able to work through all of that and still work within the budget we have right now. So when we went to budget for the phase 3, we had added some of those costs in there so that we don't come back to the board. We hope for additional money. The permit, we're still waiting for it to be issued, but we're hoping that it will come any day now. You all are familiar that the county is moving the full 9th Judicial operations from the courthouse during this construction over to the Armory, which is the former City Hall. We are moving so the DA is moving over. We have one nonprofit that occupies space in the courthouse, and all of the 9th Judicial. So they'll all be relocating over there. And I have to say that it has been a phenomenal collaboration opportunity working with the city, with the courts, the DA, FCI, the sheriff's office. It's really been a really cool effort in bringing this together and making this move happen. The benefits of the move is going to really allow us to get this project done in a more streamlined manner. We won't have to shut down for smells or noise or whatever happens during the construction. And that's what we experienced during phase 1 and 2. So when this opportunity came up, we just couldn't pass it up. And thank you for supporting that and allowing us to do this. And
quite the price tag.
And in doing that, though, we also were able to add the scope, and it was fully funded by the board to add a new roof on there. You know, the roof has well over 150 penetrations and patches on it, and by having the courts relocated out of there, we just couldn't pass up this opportunity to get this done. It has been on our list for several years, and we just couldn't, pull the trigger on it because of courts.
How old is that roof?
The roof has to be 30 years. It's whenever we put the air handling units in the attic, and that was almost before me, so it's been a long time. So again, the agreements are in place. We're waiting on the City of Aspen permit, which I heard we will have hopefully by Friday or Monday of next week. FCI is in place to make some minor modifications over at the Armory to make the security checkpoint work. That's really our only thing. We're reusing all of the existing furniture over there, so really all we're looking for is the staff, the 9th Judicial staff and DA is to pack up their boxes of what they need to do their daily duties and go over, take their box and a chair. There's a few other things, but it's really going to be simple, and we're not moving desks and all of their stuff. We've also have an arrangement with the city or with the FCI that if they do need to come over to the courthouse, they can certainly grab a file or whatever they need, really to keep it fluid so that they don't feel the need to take everything over their file cabinets.
So we can expect to see chairs full of boxes being
rolled across. I'm working on that detail. But that move is going to happen on the 10th of March. So we're really just days away from this happening. The scope of work includes asbestos abatement. The exterior stairs are going in right back here. That will give them an egress for safety purposes. Both courtrooms need to be modernized and power data. So the new jury room with a restroom will be put in place up there. The grand staircase will be upgraded. That railing is very low and it's not in code compliance. So somebody could really easily flip over that. So we'll do some modifications on that. And then the safety and security of, additional cameras or whatever they need, and then the roof replacement. The River Park Center project, which is located on Emma, we renovated 2 spaces. So the lower level, which is Suite 102, we added 10 touchdown spaces, 2 small dedicated meeting rooms, and they're just for the occupants of that suite. A combination comfort room, which they can also use as a private room, designated parking for their county car, and then safety and surveillance. Public health has been designated to use this space, but the reason we built it the way we did is that it can be used by, so if public health suddenly needs to move to Aspen downtown, we could put somebody else there, and it's it's flexible and manageable that way. And they are so grateful. They are so happy in their space. Now that the mask mandate's down, maybe we'll see people using it a little more. I personally have worked in there like 3 or 4 days, and it's just wonderful.
So it's full with public health? There's not drop-in sites for employees right now?
No. Upstairs, which is the next slide. So on the second floor,
Before you go further, Greg, I think had a question.
Okay.
Maybe on the initial.
Well, I can circle back. Thanks, Jody. I just wanted to ask about the railing on the staircase in the courthouse. Sorry to circle back to that. Just when that's modified, is that going to change a historic architectural feature? And are we trying to mitigate that? I mean, it's hopefully it's going to be something along the same lines. I'm just wondering what do you have in mind there? But you can get back to that later. I just wanted to remember to say it.
Yeah. I could quickly answer that one. So we are not modifying the wood railing at all. What we are doing is putting a metal guard behind it that meets the compliance. So there's 2 levels. So yes, we do everything we can to maintain those historic features anytime we can in that building. So good, thank you. Any other questions on the courthouse? Okay. So the River Park Center on the second floor, this has been designated to any county employee. They all have access. Everyone has access to it. You can see this pod down here in the right-hand corner. There are 5 computer stations here. So there's 4 here in the center, and then there's 1 back here in the corner. There's a kitchen back here, which is this. So you can fix your lunch or whatever you want to do. And then that kitchen is also for the meeting room that we developed in that upper space. So this is directly above Subway on the second floor, level with Stubby's. So that's usually how people know everything. This room will hold 15 people comfortably at the table, and then up to 20 people with some chairs out in the edges. And we made it really flexible. And we're actually getting a lot of use of it. Healthy Rivers is already scheduled out. We had our Dare to Lead training in there last week, and just what a delightful room to be in, to be trained and meet. So again, thank you for your support in this, and we will be able to report out to you in the next year of how much it's being used and for what. So that'll be kind of a good information. Any questions? The jail safety upgrade project is in progress. It started in February with our asbestos abatement project. So we had non-friable asbestos which was the black mastic under the carpet. So the rest of the building does not have it. It was just that black mastic in some of these cells. So that has been mitigated. It's done. We have our clearance letters, and now we are moving on to the construction of those sites. And this room that you're looking at here, which is the X and Z, those will be those holding cells and work release. So that's kind of what you're looking at right there. And those are in that temporary state. And then we've also moved all of the booking desk and operations into the intake area, which used to be the old Sally Port. So we're free to work in here as soon as we have our permit. And again, we're hoping to have that by Friday or Monday of next week. The city is just slammed with permits, but we're doing our part to follow the rules and work with them, and they've been fantastic on this as well. Health and Human Services, last year the board approved us to put in a generator. It was a fairly painful project. We weren't able to get it off the ground until November, and then we were in snow and ice, but we did get it in. It was completed in late January. It's fully operational. The HHS building, which has all of our health and human services and nonprofits, along with our vaccinations from community health, are all now on a generator, and we can operate in the event of an emergency and power outages, where we have always had that risk before on this. So we're really happy to say that's done. Other facilities updates, we are recruiting 2 senior technicians. We had 4 interviews on Monday. We'll be doing more. We are recruiting for our facilities operations manager, who left in February. The senior center offices renovation, the design is complete. We're just went in for permitting. I'm guessing that the permit will come sometime in June, July, or August, and we'll get started on that. I'm actually going to be putting out the RFP this week for the construction services on that. The nice thing about this senior services office renovation is that we will be going to pretty much the same style and concept of having a flexible space with systems furniture, systems walls. I did a tour with the senior staff down at Public Health and the River Park Center. They loved it. Very open and engaging, but they still have their privacy, and we'll be creating a meeting room for them as well. Health and Human Services repair projects. There are a ton of projects out there that need to be done. So I'm in the process of working on an RFP to do the flooring, paint, meeting room doors. And then we do have the chiller that's located behind the building that needs to be replaced. It has 4 compressors, and it's all electric. So there is no gas, natural gas being used on this replacement. So just thinking about our climate action, but we're working on being on our last leg of that. So we're going to go ahead and get that replaced. And then the Public Works repair projects will happen hopefully before June, but again, that's just flooring, painting, just giving them, a nice fresh work environment. We haven't painted or done these repairs. They've pretty much, this deferred maintenance has been done, put on hold for a little while. And so we want to make sure we can get to that. So with that, that's all I have. And
that's
I will pass it back. If there's any questions, I'm happy to answer.
Anybody on the board have any questions?
All right, we'll keep moving here. Thank you, Jody. Appreciate it. She's doing a great job. She did indicate they're down 3 employees, so we did have to contract out some snow removal to try to give a little relief, but they're doing well, hanging in there with it. So, all right, Jeff Kruger, is he? Are you online, Jeff? We're going to get him on here, and I
am.
All right.
Can you?
So Jeff is off-site, but I'll have to advance your slides for you, Jeff, so you just let me know.
I'll do that. Thanks, Rich. Well, good afternoon, everyone. First of all, I want to thank the board for the opportunity to provide you a telecommunications update. My name is Jeff Kruger. I'm the telecommunications manager for Pickens County. This is our organization and staff. We actually consist of 5 people now. This is an older picture, but we did hire an additional project engineer by the name of Kyle Nelson last year. Next slide. Briefly, I wanted to talk about our responsibilities. We're involved in a lot of services. Everything for the telecommunications department operates 24 hours a day, 7 days a week, 365 days a year. We do respond to emergencies after hours on weekends. Lately, it seems like emergencies have been occurring more on weekends than at any other time. Picture on the right shows actually repairs being done at Sunlight. That was actually last Thursday. We were up there on New Year's Day doing repairs, and the day after for that matter. And also another big recent event is we were at a dispatch center all day on Thanksgiving of last year. But this is just typical for my department. But some of the services, just so everybody's really up to speed on what we do. We have our translator TV and FM services. We broadcast TV out of Grand Junction, and we also are streaming TV out of Denver. We just added grassroots and county gov TV streaming. They updated their transmission equipment last year. We capitalized on that and are now streaming those services over our network. So everybody can now be seen in HD format, high definition. Next is broadband. We're involved, of course, in the Pickens County Broadband Initiative. We have 2 Meet Me centers now in Aspen and Basalt. We have taken on a new project called the Roaring Fork Broadband Project. We also do our own grant writing and submittals. We've been very effective with that, and we've been awarded now nearly $5 million in DOLA grants over the last 5 years. Public safety, we maintain all public safety communication systems for the county. This includes the 911 dispatch center, the Mountain Rescue Backup Center. It includes all the 2-way radios. We have over 1,200 radios today in our system. It includes our backup repeater system, and we added a 911 phone system. So we did put in a new 911 phone system last year. As far as facilities goes, we're responsible for 12 mountaintop tower sites, Meet Me centers, microwave backhaul. We have 25 microwave links now. And this has just grown considerably over the last 5 years. We also maintain all the networks, routers, and switches, and we do backup generators as well. Next slide. This is a map showing all of our site locations, as well as the microwave links. As you can see, most of these are mountaintop tower sites. We do have some communications equipment and facilities, including the jail, the town of Snowmass Village Town Hall. We also have broadband Meet Me centers, both in Basalt and Aspen, and we'll be adding fiber, and I'll get to this a little bit later, as part of the Roaring Fork Fiber Project, which extends from Glenwood Springs to Aspen. Next slide. Thought I'd briefly talk about our accomplishments last year. We have a small team, but we accomplished a lot. We completed the Thomasville site build, and those pictures were, I should have explained that, but those pictures were that very first slide in this presentation. That site was completed in October of last year. We're offering TV translator services, public safety, as well as broadband. Broadband was officially went online in December, and we are seeing subscribers trickle in. And so Thomasville, welcome to the 21st century. I know they've been very excited to have that site finally go online. Upper Red, we did a shelter remodel last year. We plan to do a full remodel, which is to complete the solar panels. Due to Forest Service delays in approving it, we will now be doing that next summer. So we completed half the project and we'll complete the other half this following summer. As I said before, we put in a new 911 phone system at dispatch. We also completed a broadband effort partnering with the RE1 school district to provide broadband to students living in the Basalt and El Jebel mobile home parks. This is a big deal, and most of these students during the pandemic were left behind. And if you recall, I believe last year we gave a talk about this, but parents were literally driving their kids to the Starbucks parking lot in order to get a Wi-Fi hotspot to do their homework. And so I'm really proud of this effort that we were able to get low-income families broadband for the first time. We installed 8 new microwave hops. These were really redundant links for the most part, plus new links required for the Thomasville site. We also added a fire incident management system to the Thomasville and Old Snowmass fire stations. We also completed broadband phase 2. So this is the completion of the Pickens County Broadband Initiative, at least for the original 6 tower sites planned. We received $1.6 million in grant awards for the Roaring Fork Broadband Project. This was a huge win for us. And then, of course, as I said this before, a grassroots and county gov streaming system is complete. Next slide. This shows you our Upper Red shelter remodel. Upper Red, for those listening that don't know, is a site that sits above Aspen. It's a shelter that was built underground. It's a galvanized tunnel, if you will. And it holds all of our electronics equipment. There's no air conditioning in here, and it keeps it cool during the summer. So we completely remodeled it. New flooring, new paint, new racks, new equipment, new batteries, new inverters, new solar charge controllers. And it's a big difference going to this site now, and a huge improvement. Next slide. I thought I'd just spend a little bit of time talking about the Pickens County Broadband Initiative. We've now completed phase 1 and 2. So this is a fixed wireless broadband system that's operating on 6 county towers today. We have about 250 subscribers on the network, and we're planning to add more. Elephant and Rudai was added actually just the year before, but Elephant and Rudai are now at the maximum capacity in terms of subscribers. So we will be adding what's called access points to both of these sites this summer in order to enable more subscribers to get on our network. We actually have high capacity microwave links to all sites. This is providing the backhaul. 2 Meet Me centers in Aspen. We have redundant circuits to Aspen via Project Thor. So we are a member of Project Thor. This includes a CenturyLink 10G as well as a Comcast 10G. And I'll get into that in a little bit more detail later. But overall, the project was highly successful. We were awarded $3 million in grant funds overall. And we offer fixed wireless services at 10 meg, 25 meg, and 40 meg download speeds. Next slide. So what do we have in store for this year? Our plate is pretty full again. We did just roll out a new telecom website. I'll go over that in a second. We are going to be replacing the Jackrabbit power line. This power line is about 50 years old, and it's simply a buried cable that's in the ground. And we also we're actually completely redesigning the power system, putting in a new transformer as well as the power line in order to increase capacity up at the site. The RFP for that was released a week ago. We're also planning to do the Upper Red solar mounts and panel replacement. That will occur this summer. We plan to release that RFP in a couple of weeks. We continue to do microwave expansion. We have a new project called the Roaring Fork Project. I'll get into that later. We have some broadband grant opportunities, and I'll discuss those later. as well as we want to put out a broadband strategic plan. We were going to do a couple of smaller projects. One was the Brush Creek Fiber Distribution Center, and the other is the Airport Fiber Project. And we're going to actually push those out to next year. And the reason being that both projects are, there's, you know, in terms of planning the new terminal, that'll occur this year. We feel it's better in line to do the airport project next year. Brush Creek, the RFP or the work is going to go out to bid. They don't anticipate that work now getting done until next year. And the other thing is we also feel like there's some grant opportunities for both of these that are coming down with regards to the capital project fund as well as the Infrastructure and Investment Jobs Act that we can capitalize on for that work. Next slide. We do have a new website, which is now linked to the Pickens County website. So if you go to telecoms.pickenscounty.com, you could bring this up. Or just go to departments and hit telecommunications. The focus really is on TV, FM translator, and broadband. The idea is to provide better feedback and mechanisms to our customers and to the community as to how they can get information. We were very limited in terms of what we could do with Civic Plus, and this allows us a lot more flexibility going forward. So we provide information on broadband, we provide links to our broadband ISPs, as well as Starlink for that matter. You can get board packets and meeting schedules from our telecommunications advisory board. You can also report outages, submit questions, and then sign up for alerts. All right, let's talk about the Roaring Fork Broadband Project. So this is now really the next chapter in broadband for the county. It's a collaboration between Pickens County, City of Aspen, Town of Snowmass Village, and Town of Basalt, and it builds on a Holy Cross Energy fiber initiative that's going to be running new fiber from Glenwood Springs to Aspen. And this is really part of their what they call their 100 by 30 initiative, and it's to be on 100% renewables by the year 2030. And in order to do that, they need fiber to their substations and offices in order to bring renewables onto the grid and bring them on very fast. So as part of that effort, we'll be leasing 6 strands of that fiber and building out from it as well. It includes a 100G network. Today we have 2 10G networks. So this is a huge increase in capacity for broadband into the valley. It also connects to Project Thor in Glenwood Springs and Aspen. And for Pickens County, it's going to be connecting River Park Center, the Southside facility, the landfill, our Jackrabbit communications site, and the Town of Snowmass Village communication site. Next slide. Here's the status of the build right now. Holy Cross Energy has completed nearly 10,000 feet of underground conduit. They have a 36-mile run of aerial fiber. They were experiencing some material shortages. They had originally planned to start this work late last year, but due to the pandemic and material issues, they had to wait, and now those materials have now arrived, and they plan to restart that aerial construction in April. As far as Pickens County goes in our piece, we've completed the design and engineering. This includes both underground and aerial designs. We've also completed the fiber optic switch design between Glenwood Springs and Aspen. And we've actually we released an RFP for all of this work. This RFP was released last Friday. As far as materials and equipment, I'm happy to say that we actually received all of our equipment, all of our materials so far. So we're in good shape. It's all being stored up at the landfill. We did not experience the delays that others have in broadband. Our fiber optic switches have been ordered, and we expect them to arrive in the next month. Next slide. So Project Thor is started by the Northwest COG. It has really one goal: provide high capacity, affordable, redundant internet to the 10-county region. It includes a combination of owned and leased fiber. Leased fiber comes from CDOT, CenturyLink, Comcast, and Strata. The backbone is 300G, and it has 10G and 100G spurs. Aspen is served by 2 redundant 10G connections from CenturyLink and Comcast. We've had fiber cuts by both of those vendors in the last year and a half, and we have not been impacted by those fiber cuts, I'm happy to say. So Project Thor has just kept us up and running the whole time. And the network has been proven highly resilient to fiber cuts and natural disasters. We had a Glenwood Canyon mudslide, and I'll go over that a little bit, but it's also fiber cuts in Vail and Carbondale. Next slide. This is the network diagram for Project Thor, showing our 2 connections from Aspen going out to Denver. We will be adding a 100G connection with the Roaring Fork Broadband Project, which is shown in red. But this architecture has proven to be highly resilient. The CenturyLink path actually takes, it doesn't run along the highway, it goes on the railroad bed through Glenwood Canyon. Our Comcast circuit goes to Glenwood Springs, and when we had the mudslide in Glenwood Canyon, we actually routed all the way around up through Meeker, Craig, Hayden, Steamboat Springs in order to get back to Denver. Next slide. This shows the mudslide that occurred last July. The little picture on the inset lower bottom shows the steel conduit that contained the fiber. It was completely mangled. And as you can imagine, every strand of fiber was cut. The picture on the right bottom shows the repairs that are underway. This was taken in January. Repairs are near completion. But this was a monumental task to try to get this, not only the road repaired, but all the fiber repaired as well. Next slide. So I thought I'd take it after our county manager and show a cartoon, but this is there's a lot of truth to this. And with the pandemic, the federal government is throwing billions at broadband right now. And I'll go into some of the, I'll go into chart a little bit later, but really this includes 2 major areas, one being the American Rescue Plan Act, and the other being the Infrastructure Investment and Jobs Act. A lot is really unknown about the Infrastructure Investment and Jobs Act, but we anticipate anywhere from about 100 to 500 million that will come to the state for broadband. As far as the American Rescue Plan Act goes, there is going to be 171 million that comes to Colorado. We're currently involved in what they call listening sessions, and that's to determine a mechanism to determine allocation, proposal methods, as well as funding mechanisms. We anticipate the grant applications will be expected in late 22 or early 23. And a match, they haven't really decided yet, but this could be anywhere from a 0 to a 25% match. Typically, most of our matches in the past have been 50% for any broadband activity. So I think this will allow us to take on larger capital improvement projects going forward and more projects given the anticipated match. There's also from the USDA. Go ahead.
I think you're good to go, Jeff.
Okay. There's also a grant program called the Rural Development Broadband Reconnect Program. This has actually been around for years. This next go around, they have 1.1 billion in grants and loans. They tend to do more loans than grants. And when they do grants, they're typically partnerships between public-private sector. And but that's certainly another opportunity we can go after. Next slide. So I put this chart together. Really, it's a combination of research and attending some of the Colorado Broadband Office meetings. And this kind of shows you in a little bit detail what grant opportunities there are from the various acts that have passed. The ones in gray are either have not passed or funding is unknown. So Build Back Better Act right now is not passed, but the American Rescue Plan Act, Investment and Jobs Act, and the USDA grant program have been passed. Both ARPA and IIJA are managed by the U.S. Treasury. The Reconnect is managed by the U.S. Department of Agriculture. As far as the American Rescue Plan Act goes, there is the state and local federal recovery funds. 1.2 billion went to the state. 3.45 million is coming to Picken County. That can be used for broadband, but from what I understand, you certainly have other priorities, and it doesn't need to be used for broadband in my mind. There was also a bill passed by the Colorado Senate, which is HB 21-1289. That included 70 million for last mile as well as tribal nations. And it also included 5 million for interconnectivity middle mile grants. Both of those are closed right now. We think the big ones for us going forward are the Capital Projects Fund, or the CPF. Again, it's 171 million that's coming to the state of Colorado. The only thing that they have decided on is 8 million is going to administrative funds. The rest of it is going to infrastructure projects, equity, technology projects, as well as community facilities. What the amounts and allocation for those three have not been determined. For the Infrastructure Investment and Jobs Act, there's two funds. One is called BEAD, which is Broadband Equity, Access, and Deployment, and the other one's called DEC, for Digital Equity. And DEC is really a form of a subsidy for low-income households that need help paying for broadband. BEAD is a capital improvement project, and again, unknown, but we know it's a minimum of 100 million that will come to the state of Colorado, potentially up to 500. And just one more thing to add. So we are involved with the CBO office, state of Colorado, in kind of forming these allocations for the Capital Projects Fund. They're called listening sessions. It's not listening to them, they're listening to us. So they want our input on how to do this. And so we've been very active in providing that input. Next slide. This is kind of cool. So Governor Polis just signed an executive order, 202-2009, and it is to develop a broadband strategic plan to connect 99% of the households by the year 2027. This is very ambitious. And, but yeah, we wholeheartedly support this, and given the pandemic and a lack of good broadband in our county, this is absolutely needed. Next slide. And along those same lines, this is something we'd actually planned last year, but we also plan to do a broadband strategic plan going forward. really what's the vision? What are our priorities for the next 5 to 10 years? We need to develop cost and sustainability models going forward. Do we expand wireless services? Will Starlink fill those gaps? And then how do we build out the Roaring Fork broadband project? This is a fiber project. We should extend and build out middle mile fiber from that. Possible areas include Crystal River Valley, Frying Pan, Maroon Creek, and east of Aspen. And then also building out last mile fibers. That's something the county wants to do. Should it be ISP owned? Should it be public operated or private operated? There are many municipalities and counties that are actually doing their own last mile fiber. Rio Blanco is a good example of a county doing it. Municipalities are doing it as well. The city of Glenwood Springs is building out fiber. Fort Collins, Boulder are doing it as well. And that finalizes my presentation. Does anybody have any questions?
Go ahead, Greg.
Yeah, great, Jeff. Thank you. I appreciate the presentation. It's great to see all that's been done and what's happening. It's very exciting stuff. I'm just wondering about community feedback to what's already been done. Have we heard, is there any way of finding out if the community is feeling served well with this? And do we have feedback forms, anything like that? Thanks.
Yeah, thanks, Greg. No real feedback forms. We do get a lot of calls, mainly people in rural areas that cannot get onto the PCBI system, usually because they don't have line of sight to the tower. And then we get other calls with frustrations in terms of performance and speed. Somebody who is, wanting to move to Redstone and open up a small business and needs a high bandwidth connection. Well, they can't get it through our system and they can't get it anywhere for that matter. And so the only way to solve this is through, middle mile, high capacity fiber going to these places. But I think that's a good suggestion, Greg, is maybe the time to do some kind of feedback or survey form going forward.
Yeah, the reason I brought it up is I did hear from some people who were, they were frustrated up in Rudai before you got to go up and rolling, and they're probably much happier now if they're in the line of sight or whatever. But I think the complaints I've heard have often been with the ISPs and people that may be beyond our control. But it would be nice to have an understanding of how it's going out there. Once all this infrastructure is in place, if a private company isn't fulfilling the rest of the final mile or whatever, we should know that, I think. Thank you.
I agree. Thank you, Greg.
Steve?
So I can give some feedback right now. We are on both the broadband, the county broadband system, which that's my Zoom call right now. There have only been about 2 times in well over a year when, something happened and the system failed. I don't know where it failed, but it's been just terrific. I know a couple times Pathfinder has had issues that the last one was located somewhere towards Denver that they resolved that. And also we're on the television system and are, pretty darn happy with it. I don't have all the features of like being able to search through the menu of all the shows that are showing that we could see on our satellite TV, but it's been really good service. I guess my only complaint, once in a while, a whole set like the Glenwood Springs ones that are the number 3 on the dial, maybe all of them will be not working some for a couple of days. And that seems to be the one that usually goes out. But I understand that why some people who rely on watching television for their entertainment all the time would probably complain to you all the time, Jeff, if their favorite channel suddenly isn't working. But since
yeah, thank you, Steve. Let me answer that real quick. So Channel 3 has been out at the source, on and off. We actually have a banner at the very top of our website that says Channel 3 transmitter is intermittent right now, and they don't plan on replacing it till spring or summer. So it's one of those things. It's unfortunate, but it's out of our control.
yeah, that's what I figured. But anyhow, I give a full endorsement for anybody to use both of those systems. And it's not 100% foolproof, perfect all the time, but it's better than what we had before. So let's see. My other comment is I missed seeing the graph with all the red and the green for the status of the different sites. It used to be all pretty much all red, and it's probably all pretty much all green now. So maybe that's why you didn't show it this time. But because I know that you've been working really hard on upgrading all of the different sites. So do you have any more ones that you would still consider red at this point in time that need like a complete overhaul?
We do not, Steve. We're everything for the most part is green. That's why I decided not to show that chart again. The only thing that's not fully complete is Upper Red Mountain, and that will be fully green after the summer. And then we do have a public safety site on the top of Ajax, top of Aspen Mountain that does need to get rebuilt. That's in our 5-year plan. But it's okay right now.
I have a question, Jeff. It's the same one I asked the last time I saw you. So what is Starlink going to do to all of these attempts to fill all the needs of rural internet?
Could you repeat the question?
I'm
sorry,
wondering
Nancy.
what Starlink is going to do to fulfill the needs of rural internet. I mean, you guys have put a tremendous amount of money and time and effort into getting internet to everybody in our rural communities, but is Starlink going to be able to basically take you the last mile?
If you can believe, we're still waiting for our Starlink dish. We ordered it March of last year. Mm. So this is a big problem with Starlink right now is they tell you that it's going to be 6 months out, but in effect, it's been a year. We were able to get our hands on a Starlink dish. We actually used it. It was somebody who had actually gotten one here in the Valley. We actually used it during our Thomasville site build. I can say that a Starlink is a great option. It can be difficult, for doing your Netflix downloads, for doing your email, your web browsing. One of the problems with it is if you're on a Zoom call, it can cut out. So you can have cutouts on the order of about 2 minutes. And it's difficult to work from home, I think, on a Starlink if it cuts out over a 2-minute period and you have to reestablish all your links. But that's going to improve as they get more satellites in the sky. They have 2,000 now. I believe they're on ultimately trying to get 12,000 satellites. So it's a huge project on their end, but right now it's a little bit spotty still, but until they get that full constellation in the sky, you're going to get dropouts.
And is it more expensive than our local broadband?
It is. You have to pay an upfront cost of $500 and $99 a month. There is no upfront cost with us, and you can get 25 meg download for $70 a month.
I see. Okay, thanks so much. Does anybody else have questions right now for Jeff? All right, well, thank you so much. Oh, wait, looks like Steve does. Go, Steve. You are muted,
You're
Steve.
muted.
I want to comment about Starlink. I do not like Starlink. The fact that they're putting that, private company changing the night view by putting so many satellites in the air, to me is unconscionable. I think our system should be based on, like we are doing here, in the county. And also, like Starlink just launched a group of about 44 satellites, and 40 of them fell back to Earth. They didn't make it to their full distance from Earth where they needed to be, establish their spot in the sky. So it's not infallible. I think that electromagnetic storms can really affect it tremendously. And I personally wish the company didn't exist and that wasn't an option. So I'll leave my comments at that.
Okay. Thank you, Steve. Thank you so much, Jeff. We really appreciate the update. Sounds like you guys are doing amazing.
Thank you, everyone. Have a great day.
Thank you. Jeff was a new addition to our team here just recently, and you can see the tie to the infrastructure and what we're doing. So, and Steve, you could see his red, green, and blue influence whenever we did the retreat. He helped us with our overall project thing, and you remember that? It was full of red, green, and blues, or red, green, and yellow. So, all right. Our last presenter is Dan, and I'm going to slide this over to him.
Okay. Do I need this?
There you go. Now it should be on, and you're
set.
ready to go. You bet.
Okay. Well, good afternoon. Before I move on to my presentation here, if you aren't aware already, we did have an incident with an aircraft yesterday. We had a small business jet called a Hawker 800 that aborted takeoff late yesterday as it was departing the airport to the north. It wasn't able to get off the runway. It aborted takeoff and slid off the north end of the runway about 100 yards. There were 4 passengers, 2 crew on board. Nobody was injured. And we had an incredible response from our mutual aid partners yesterday. I do need to thank them publicly. They did an amazing job. Alex Bruschetta with the Picnic County Sheriff's Department took over as the incident manager, and he did a seamless job yesterday. In addition to our mutual aid partners, including Roaring Fork Fire, Aspen Fire, Aspen Ambulance, and Picnic County Public Works, Road and Bridge Department helped us with some equipment. And the airport staff, I am proud to say they did an absolutely flawless job yesterday. Fortunately, it wasn't an incident where there was any loss of life or any injuries, but it was a very seamless situation, which we're happy about. With that, I will move forward with my presentation if nobody has any questions on yesterday. Yep, sorry, Kelly.
I guess I'm wondering, is there any consequence for the pilot and crew for that takeoff? I don't know, were they leaving in inappropriate conditions? Is that ultimately a decision of the pilot? And with such, I think, delays, are they on the hook for anything because of that?
That's hard to say at this point. I'd hate to speculate on the actual cause of what might have gone on there. We actually have the FAA and NTSB coming up tomorrow and later this week to investigate. This aircraft, from what I understand, does have a cockpit voice recorder, so that'll be removed and analyzed. So usually with an accident of this type, it's a cascade of events, so it could have been a number of different possibilities. But if it was, an aircraft operator incident, yes, there could be ramifications for them. Yes. Okay. Well, I will move forward then with the presentation. I'll give you a quick update on what we're doing out at the airport now and as we're moving forward. So as you're probably aware, we've moving forward with our airport layout plan project. This is really our process of capturing the community vision recommendations onto a formal Federal Aviation Administration document, which allows us to start moving forward with implementation. And not only implementation as it is physically, but also makes our projects available for federal funding at that point. So at this point, we're moving through the actual ALP process. We have retained a consultant, or we're in the process of retaining a consultant, I should say. We will then move into obtaining airport data and everything. from everything from our property boundary to the airspace to every tree that is poking through our airspace, to every runway light. We will be capturing all of that data. So there will be a tremendous amount of data that hopefully we don't have to update through Starlink. But we will move forward with that. Sorry, Greg, or Steve. We will then develop the ALP in a narrative document. We will transfer that to the FAA. And if we do this correctly, and we're hoping to do this in partnership with the FAA, we will get FAA approval. And then we can move forward into updating any environmental documents we need to. We've gone through the environmental process, so we're hoping in many ways for most of the projects we're looking at here, it's just a written reeval at best. There are some other projects on there that will be new that were not captured in the previous EA. We will have to go through the full environmental process, but we will address those just before we plan on implementing the project. We plan then to move into, from an orderly standpoint, terminal design, air traffic control tower design, terminal construction, air traffic control tower construction. And then once those particular items are out of the way, we can then move into the airport improvements, such as sliding the taxiway to the east, and then going forward with some other airfield improvements. We do have a number of airfield pavement repairs on the horizon here. Our pavement is approaching the end of its useful life, about 20 years. And that's usually what you can expect out of an asphalt type pavement for an airport. So to address this and to allow us to move forward, we will be doing a 2-week closure in May of this year, from May 2nd to May 16th. We've been working with our airline and airport partners on this closure. And what this project really will entail is a 3-inch spot mill and overlay on the runway and some areas on the taxiways and some areas on the ramps. And then when we're doing this, we will also do the runway grooving and give us better friction on our runway. The runway grooving, because we have to allow the asphalt to cure a bit, will take place in August, but we'll do that during the night, or nighttime work, so we won't close in the airport for that work. This is being paid for mostly through federal grant funding. There is a slight local match that goes along with this, and Colorado Department of Transportation also provides us a grant for a portion of this. We will probably, until we do a complete reconditioning or redevelopment of the runway, either as it sits currently or if we're forced to move in a different direction, we can expect to probably have to do this annually, just because of that age pavement. Although I should say that we're going to accomplish enough this year that next year we shouldn't have a closure. We'll be able to do spot taxiway closures hopefully next year, unless we run into something where we don't foresee. But we can take care of it this year, get it done early, so we don't have to deal with it next year. We'll just do some spot taxiway things. We can phase that in, so we don't have to do an actual full closure for that. And one thing I think it's worth mentioning here, we've been trying to work with our Public Works Department to try to partnership on projects if we can. Less mobilization for projects, trying to share costs, things such as that. With this project, we actually tried to partner with them on some road projects. So as they're bringing asphalt and other things up valley, we could do it in one trip or similar trips as opposed to separate projects. Unfortunately, due to the kind of asphalt, in this case, based on the size aircraft that comes into Aspen, we can't use the same type of asphalt. We have special specifications on the asphalt for the airport that just are above and beyond what are needed for a road. Therefore, we weren't able to partnership, but we're going to look for partnership opportunities as we move forward with things. It's just environmentally it's good, cost savings it's good. Just to give you a quick idea of what we're running into out there at the airport pavement, we did some core samples this year because what happens on the surface, we're not sure what's happening below the surface. We see cracks and things on the surface, but we don't know if something's more egregious subsurface wise. This is what a typical core looks like, and this is actually from our airport. So I'm not giving you this is what it should look like, this is our airport type thing. This is actually from our airport. Most of our cores look like this. We're in decent shape. However, we did have some cores that look like this. And this shows some fairly extreme subsurface distresses for the pavement. That's why we're going to have to do a rehabilitation probably in 2024 for this runway. but we can limp along till then. We're hoping it's a partial rehabilitation, but it could run into a full rehabilitation. And that could run into possibly a month or more closure during that process. While we're doing the pavement project, to take advantage of the fact that the airport will be closed and a possibility that the Embraer 175 aircraft may be coming into the airport this time next year, at least that's the read we're getting, we're going to convert 4 of our parking positions at our terminal to be dual use, as far as they can park an E175 or a CRJ 700. We expect them to use this aircraft coming up. They hopefully address some of the limitations of that CRJ 700 aircraft. The older technology that's in that aircraft requires higher approach minimums. That's why you start getting the cancellations or diversions of those aircraft, because they just can't get in with some days similar today, like today. They have limited range. We can get a flight in roughly from Atlanta to here, which means if there is poor weather here, they can't circle as long. They end up having to divert nearly right away. And then there's a mechanical reliability. A lot of times we have to cancel flights due to mechanicals. Hopefully this reduces the cancellations, diversions. We will take care of those ramps during the closure. We'll just have 4 positions closed. We really, at that time of year, only need 2 positions. And those will be closed for a month because we're putting in concrete pads and those need extra time to cure. And this just shows you kind of some of the differences. The aircraft are very similar. Really the only primary difference is the wingspan is larger, and that is why we have to go in and make some modifications to the terminal gate parking, the aircraft parking areas. To give you a little bit of an idea of exactly what we're planning on doing. So right now we have 8 CRJ 700 spots. We're going to convert 4 of them to be dual CRJ 700 and E175 gates, but we're going to do this in a fashion where if we end up converting all 8 at some point in time, we're not undoing what we're doing now. Okay, so the money we're putting in, the time and the effort we're putting into it won't be undone if there are changes down the road. But right now, these gates, so anything in the green you see is going to be a concrete pad addition. The white is the addition of a new ramp for that to board and to plane and deplane that aircraft. These aircraft are slightly taller, therefore it would be an extreme grade for people to climb up if we kept the existing ramps. Just could not. Plus these aircraft positions are going to shift slightly and our current ramps are bolted down to the ground. These new ramps will not be bolted. We will be able to migrate those to any future scenario that we have. So these gates are the ones that are going to be converted right here. 2 of them are going to require some additional pads. 2 of them we can use existing pads that are already there. And these pads keep the aircraft from sinking into the asphalt.
So the drawing there of those planes shows the wider wingspan?
Shows the wider wingspan.
Okay.
Yep. Yeah. Exactly. We do have one additional gate we're going to address here. We have one aircraft that is actually positioned too close. And how do I put this? It is in a situation where the tug that pushes the aircraft back sits over a trench drain we have there. And a fire code says that we should not have that. So while we're doing this project, we're going to we have to shift the pads a little bit, and we're going to push this aircraft back slightly. Just helps us address a code issue, more or less. We're going to remove the 2 remain overnight or Iran positions that are sitting out in the tarmac there. Those are really inconvenient positions from the airline's perspective. They're just not very usable. And as you can see, they block other aircraft from departing while another aircraft's sitting there. Now we were able to work with the FAA. This is a portion of the apron you can see to your left there that needs to be rehabilitated. It's in very poor condition. So the FAA has agreed as part of this project, they will pay for this rehab right in this area. Typically, they will require the airport to pay for that or use of passenger facility charge funds to pay for that because it's really almost exclusive use for the airlines. But they have agreed in this case, they will fund it. So as long as they're doing that, what we're going to do is put a remain overnight. This is not a gate. Okay, there will not be a ramp here or anything like that. But this is to transfer. We'll take those 2 remain overnight positions, transfer to a single remain overnight positions off to the side there that can accommodate both a CRJ and an E175. Okay, so it's really a net loss of 1 remain overnight position, which is fine. And we'll have to put in 2 pads there. But again, we won't be striping it special for an aircraft to board and unboard. It'll just be a remain overnight position. So a net will be really removing one remain overnight position. So moving forward, these are some of the other projects we're working on right now. The fixed-based operator solicitation. It's a existing lease expires in September 2023. We'll be going out for a new 30-year lease. We expect the second quarter of this year that solicitation will go out. We'll probably give them roughly 4 to 6 months to respond through that process, and then they will be selected through a fairly robust project to construct and operate a future FBO on the airport. And then the Airport Advisory Board commenced on January 20th of this year, and is meeting on the third Thursday of every month. Next meeting is March 17th. And then at every meeting, we like to have a focus topic, and that allows us to bring in experts if we need to, but to have something teed up and a focus at every meeting. And these are just an example of some of those topics. Right now, we're having the advisory board work on prioritizing those topics. Some of the topics are sort of already being sort of predestined for priorities, such as the airport layout plan, the FBO, a couple other things. But we'll also allows us to tee up these experts so we can ask them if, perhaps, hey, September, can you come out and give a presentation in this? And it allows them some advance notice to put something together. We also have a discussion of hot topics. I have a pretty good idea what one of the hot topics will be this month coming up. But we try to capture items during that month that we've received a number of phone calls on, whether they're tarmac delays or why are general aviation aircraft being prioritized over commercial aircraft, things like that we want to use this as a forum to kind of get that message out there and get the truth out there a little bit. And then some of the additional projects we're working on, as was mentioned, the microgrid project. We will be replacing what we call our CABA unit. It's really a passenger backflow preventer, so people can't go from the baggage claim area back into the secure area. We had some issues with this earlier in the year, last year actually. So it's not operating as it's designed to do. We're having to put a person there to watch this. That gets expensive. So we're going to be replacing this later on. Hopefully this is a modular unit that when we build a new terminal, we can lift this unit out and take it over to a new terminal. So it's not a complete throwaway at that point. We're going through an organizational evaluation, succession planning process at the airport. So we brought in a consultant to evaluate how we do things. Are there efficiencies we can capture? How can we work with existing staff to allow them to succeed with us in the future and give them a path to grow? We'll be doing a PFC, or passenger facility charge application. This is going back to the airlines to request funds. One will be for the airline ramp modifications that I discussed already with the E-175. And then we have a couple pieces of snow removal equipment that are aged and we need to replace. We will be going out for an engineering services solicitation. This is something I'm working with GR Fielding on, Public Works, and this is really for our pavement maintenance on the airfield. And that is pretty much it. So I know time was getting short there, so I kind of rushed through that a little bit.
It was great, not to worry. Very clear. We have any questions for him? Yeah, Greg.
Yeah, Dan, I just wanted to know about the remain overnight space.
Mm-hmm.
If we lose that space, does that mean, how often does that mean we won't have an extra plane on the ground in the mornings ready to go?
It's hard to say. It's nice, especially during the busy time, it's nice to have an extra spot for, if the schedules don't work out perfectly, to have an extra spot for an aircraft to sit. That's really when it's used. I anticipate it won't be used very often. But it's nice. It's good to have as a pressure valve if we need it.
Got it. And so you think one will be enough? High season, holiday season, bad weather events, things like that. Is one going to be enough to? I guess the whole thing isn't full of planes most stormy winter nights. I always think about that. Usually, it seems like there's two planes that are on the ground ready to leave in the mornings, regardless.
True.
And that's not going to affect that.
That shouldn't affect. That, and quite frankly, we rarely use those ROM positions that are actually out on the tarmac. This will just make it safer and more efficient in case we do need it.
Great, thank you.
Sure.
Any other questions?
Steve here.
There you are, Steve.
Dan, there was a ramp issue when I flew into the airport on December 24th. I think I was on the first plane that came in the evening, all day long after snow all day. And going down the ramp, I actually skied on my shoes all the way down the ramp. It was like it wasn't a sheet of ice. I think they had removed the snow, but it was slipperier than all get out. And I personally enjoyed skiing down there in my shoes, but if someone was not used to that, and I don't know if that would probably only be an issue when it snows, but I don't know. Do you put de-icer or anything on the ramp actually to prevent it from icing up?
We try to replace the matting that's on there when we can. I consider myself young and spry, but I still actually have a little difficulty getting up and down those sometimes. They're quite steep. They are aged, so that's something we may be looking at replacing as well.
Yeah, and then also I took some photographs in Panama City, Panama of their jetways, which I love them. I think I need to send you photographs of these jetways. They're fully enclosed, but they have glass on the side, so it's windows on the side. So it's not open air, but you can see the view, and it was really delightful. I think it was the nicest jetways that I've ever been on, actually. So I'll send you photographs of those. It was just a concept that, when we're looking at jetways at some point in the future, to consider those.
That'd be great. I appreciate that. Thank you.
Any other questions for Dan? Thanks, Dan. That was awesome.
Thank you.
All right, board, I think that concludes the presentation, so
All right.
thank you for the time.
Yeah, thank you, Rich.
You bet.
So now we're going to do a review of future agenda.
Could I just ask, if possible, I'd love to have people's presentations. There's some interesting grant information and
You bet.
timeline horizons that would be helpful to have.
Yeah, I can
That's
do
it.
that for you, Kelly. I'll get those sent out to you.
Thank you, Rich.
You bet.
All right, we're going to do a review of future agenda calendars. Rich, I think you have something to add here. Did you say one change of?
Oh, yeah. John, have you got that up on yours? I'm sorry. Civic Plus, there were a couple of things with the agenda.
Yeah, I can get that real quick.
Okay.
I do have a couple.
I'm still trying to get out of this.
Guys are quick. Okay, so future agendas. Really, the only item, just a reminder that we did schedule the clerk interviews, 4 applicants, 30 minutes each on March 8th. We do have those back to back right now from 10 to 12, and not sure if the board wants to start a little bit earlier to give a little bit of time between each applicant, just to give a little bit of slip time if there's any interest in, say, starting at 9:30. So wanted to put that out to the board.
Well, I will be recusing from that because my daughter-in-law is one of the applicants. What do you guys want? Do you want to start a little earlier and have some time between the interviews?
9:30 would work for me, but whatever, I mean, we could do back to back or.
I'm pretty ambivalent. 9:30 is about as early as is easy for me to do with drop-offs for kids and such.
But it's possible. You'd be okay with it?
Yeah, it's possible.
I could do that too. That's fine. If you think you will need it, then sure, why not?
And on that topic, John, are we assembling a list of questions or anything?
Yes. The
list growing in my head. So if other board members need some inspiration.
Yeah, so the short answer is we're going to recommend some questions as staff. I've also reached out to Janice on any questions that she may recommend to the board. If the board has questions that you'd like to suggest, you can send those to Charlotte and myself, and we can get those compiled for the whole board.
Well, while we're on that topic, I was just talking with Janice during our lunch break, and she's wondering if you all would like to do a tour, and me actually, of the elections process with her and possibly with a couple of the election staff so that you actually know what you're interviewing for. And she's willing to take an hour between now and the 8th at some point and do that with us. So is that something you guys are interested in? Yes? Yeah, okay.
I'd be, yes, definitely. I'll do it.
Yeah.
All right.
I would be interested too. I mean, it's been, I had a tour like 9 years ago, but that was the old facility. That wasn't the new facility.
And Kelly, we know you know all about it.
Yeah, don't schedule around me.
Yeah, you don't have to go.
You know, I've been a judge, you know, as well in the last couple elections. I feel pretty up to speed, but happy to attend if it works.
Okay, so do you want to look at scheduling that, Sean?
Yeah, so we'll look at an hour. It sounds like it'll need to be posted because we have at least 3 commissioners who are interested in doing that tour. Did I capture that correctly?
I think you did.
And we'd like to do it before March 8th, if possible, so that you have some insight into that before the
So that's next week.
interviews.
Yeah. Okay, any other changes or additions to the?
Didn't Kelly, I don't know if I don't want to make an assumption. I thought you were ambivalent because you know this process. It may just be, would it just be Steve and me, or are there 3?
No, I would do it. I'd do it just so
Oh, you
I'd
do it
know.
anyway. Okay,
Yeah.
all right, that solves that. Thanks.
And Patty might
more the
want to.
merrier then.
And maybe Patty. So any other changes to the future agendas?
None on my end.
Okay, so discussion items. Do you have anything for that, John or Rich?
Well, there might be some future agenda items from board members. You may want to check in with the rest of the board here.
Board members, do you have any future agenda items? Steve?
I did have one on the March 8th. It's the Perry Will is coming, and on our agenda it says Perry Wills with an S on the end. And maybe it was supposed to be an apostrophe S, but we want to make sure his name is spelled right on our agenda. In case he reads it, I don't want him to be offended that we don't know his last name is Will.
Okay.
The title would probably be appropriate as well.
And Kelly, you had something for future agenda?
Yeah, I'm wondering for the joint meeting with P&Z, do we need prep time for that? Or are we just continuing on where we left off the last meeting?
My understanding is we were kind of continuing where we left off last meeting, but if the board would like to schedule some prep time, we can certainly do that if you want to have some discussion ahead of time.
I would attend that.
I do think it would be help if we reviewed kind of the summary takeaway, because I feel like maybe it would be helpful in case we think the discussions have shifted.
Got that?
Yeah.
Okay.
Can I ask a question of just my fellow commissioners or staff, first regarding the Perry Wills visit? You know, this is a campaign season. He's a candidate. He hasn't been here since he was elected. Now he's coming. So I feel a compulsion to invite the other candidates for that seat. Are we going to be doing that?
I mean, I'll chime in. For me, I guess the invitation was more about his legislative agenda for this session. we probably would do well to get on a page for ourselves about bills that we want him to support in preparation for that meeting. Maybe we can do that for open discussion next Tuesday. Does that give us time, or let's see.
So he is not our representative right now. If he is reelected, starting next January, he would be our representative for Pitkin County if whoever is elected, Perry will or one of the Democratic candidates. But right now, he doesn't represent us, so it does seem a little bit odd that he is coming in. I think we should invite the other two candidates. Actually, might be the proper thing to do.
And certainly the first questions I have for him are pretty much related to positions he's taken in the past, and I guess that it would make sense to me to think of this as a political visit.
Well, he definitely will be District 57, right? So it'll be Kohlberger and I've forgotten the other person's name, Elizabeth something, and they'll be in the primary, and then one of them will face him. So. I mean, I've been talking with Kohlberger quite a bit.
Invite them.
What'd you say, Kelly?
It just seems a little strange for me to invite candidates for an office. I mean, he is a person in office who now with redistricting has an interest in Pitkin County's position. And so I thought the conversation was related to like what's happening in the General Assembly now.
Yeah, that was my understanding when the board asked for it. I would caution the board about providing a forum in your meetings if this is really about candidates versus upcoming legislation. This is a little bit of a unusual circumstance with redistricting, and you do have a sitting legislator who will be making decisions on legislation. It does have upcoming interest in Pitkin County's position. And so I thought that the board was more scheduling time to talk about the upcoming legislative session. I would caution against creating a forum for candidates for various offices in your meetings, but that of course is up to you.
Well, what do you think, Greg? I mean, I thought it was Patty who really wanted him to come in and talk to us, and she's not here, so.
Right. Yeah. Yeah. No, it does seem awkward, though. It does seem a little awkward, and I think either way, the more information, the more sunshine is on everything, the better, in my opinion. But I get John's point. FaceTime has its value. I'm trying to sort this out. I don't know yet, so it's a good conversation to have, but I don't have a conclusion yet.
Mm-hmm.
Yeah, I like Perry. I would enjoy having him come, but I think we should make it clear to him that it's solely for talking about legislation, current legislative session, and what bills are there that he is sponsoring that affect us, and his position on some of the bills that we're interested in. That should be what the topic is about.
Should we talk about it when Patty gets back, or next Tuesday? Are you guys okay with that? Okay. Anything else on agendas? Okay, anything for open discussion? John, do you have something for us here?
Yeah, give me just a second. Yeah, so couple things. I actually had Janice's request on open discussion versus future agendas, so I think you all have addressed that.
I did too, actually. But
We do still have the outstanding request from the Aspen International Mountain Foundation funding request for the September event. They had requested $25,000. It may be best to wait for that to come back until we have a full board. But I did want to check in and see if this board needed additional information or presentation to make that decision, or if the written information that you received from Mr. Starr right now was sufficient. And we can schedule that for open discussion next week.
Well, for me, I have seen the whole presentation from Carino pretty much. We went out to dinner one night. She told me all about it a while ago, like months last summer. And she didn't tell me what she was going to be asking for, but she was very excited to be involved with it and told me a lot of details about it. So I don't need another presentation, but I wouldn't mind one. And Greg and then Steve.
Yeah, I guess I feel the same way. I don't think I need another presentation. If they have any updates, I know some developments have come up with some new partners and things like that, that make it more, that sound like they integrate it more into our community and give more relevance, which I think is important. So if there's anything else they want to bring us, great, but I could probably vote to approve it, anytime. I'm in favor of it, but they have more to share with us. Why not? But also, I know Carino probably could actually make it to a meeting now. She heals very quickly from her ski accident, so we might see her if we do schedule something.
Steve?
So next Tuesday, I will not be here. There's a possibility my other meeting might have ended by then and I could Zoom in. I will be in Denver, but I can't guarantee that. It depends on when the Farmers Union meeting gets over with. They're scheduling it to end at 5, but it could end, an hour or two earlier than that potentially. It's like a 2.5 day meeting.
Kelly, did you want to weigh in on the mountain thing, whatever it's called?
I thought in our last, I was fine to approve the funding and defer if somebody really wanted the presentation. I feel like Patty was the one that really wanted the presentation. So I continue to sort of feel that way. If it's really that important to her, it doesn't sound like that needs to happen, but.
Steve, are you in favor of the funding? I'm wondering if we have four of us in favor of it, if we need to pursue this anymore. If Kelly is okay with it and Greg's okay with it, are you in favor of the funding, Steve? I wasn't sure from your response.
Well, I was hoping that they could come up with some more funding that we wouldn't do the full 25,000. I'm okay with funding, half of that, or 10,000 or 15,000 or some amount, but I was hoping that they would get more sponsorship from local companies or whatever that who could make our amount less. So I think that's something they could maybe give us updated information on their budget. I think is kind of what we were looking for.
Okay.
Well, we will work to get something scheduled and bring the decision back.
Okay.
And that is it for me. Just a note, I'll be out towards the end of next week. Dan and I are going to be headed to an airport conference, a legislative conference that will cover a lot of the infrastructure bill related to airports. So
okay.
We'll be out the 3rd and 4th. That's it for me.
Oh, yeah, Kelly.
Yeah, I just sort of want to hone in a little bit on the conversation perked by Representative Will's visit, because I think we all should get on page about a legislative agenda that we want him to support or any of our legislators to support. We haven't really had that conversation yet this session. I think now that we're kind of midway through it is probably a good time to check in and advise each other about bills that we're all following and positions that we want Picken County to sort of wholeheartedly get behind. So I guess my recommendation or suggestion would be if we could each come in next Tuesday's open discussion, or Steve, if you're prepared tomorrow to do your portion of it or not, or by email if you can send it in, the list of bills that we're kind of individually tracking for the various committees we're appointed to and a recommended position for the board to take. I think that would help have a good conversation with him and also just be able to sort of us each back each other up in our advocacies when we talk to legislators. If that sounds good to everybody, we'll probably need half hour or more time, I would think, during open discussion to do that.
That's a good idea. Did you get that?
Okay. Is that okay?
It's okay with me.
Okay, cool. Thank you.
Do other board members have any discussion? Well then, with that, I'll look for a motion to adjourn. Or can we just adjourn? We just gonna adjourn? Let's do it.
Yeah, we're done for the day. Good job, Nancy.
Great, we'll see you guys tomorrow.
I'm gonna try and come in and sit with you tomorrow, possibly.
Oh, that'd be great.
Is anyone else, Kelly?